going, I want to remind people who wish to speak that I have a list of people who have signed up in advance. And if you have not signed up in advance, you'll have to raise your hand when I ask if there's anyone else who wishes to testify. Official script. As chair of the House ED&A Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with House Rule 67 and the governor's emergency order number 12, first consecutive order 2020-04, this public body is authorized to be electronic. It is a public hearing on bills referred to the committee and scheduled on House calendar. An executive session may be held on any bill referred to the committee that has already had a hearing. Please note there's no physical location for members of the public to observe and listen contemporaneously to this meeting. However, in accordance with emergency order, I am confirming that all members of the committee and select staff have the ability to communicate contemporaneously during this meeting through the Zoom electronic meeting platform, and the public has access to contemporaneously listen and, if invited, participate in the meeting by the Zoom platform or by telephone. All necessary information on access has been made available in the House calendar and through the electronic calendar on the General Court website. The notice for this meeting complies with House rules and RSA 91A. Anyone who has a problem accessing the meeting should call 271-3600 or email hcs@leg.state.nh.us. If the public is unable to access the meeting, it will be adjourned and rescheduled. All votes that are taken during this meeting will be done by roll call vote with video participation. Let's start the meeting by taking roll call attendance. When each member states their presence, please state whether there's anyone in this room with you during this meeting, which is required under the right to know. And Representative Broda, would you please call the roll?
Thank you, Madam Chair. Representative Allegro.
Here.
Representative Bailey. Representative Fellows.
Present alone.
Representative Goley. Yeah, I'll come back. Representative Judy. Representative Lanzara.
I'm here and alone.
Representative Likas.
Present.
Representative McGuire.
Present.
Representative O'Brien.
We're supposed to be stating where we are as well as that we're here.
That's right. Representative O'Brien, can you please unmute yourself? You have to unmute yourself. Sorry.
There we go. I'm present and alone.
You are physically.
Or physically where? At home, in your office, in the legislature?
Oh, for me,
Yes.
I'm in my, at home in my office.
Okay. Thank you.
You're
Representative
welcome.
Pearson. Representative Roy.
Here.
Are you at the LOB?
Yes.
Representative Santo Nastazo.
Excuse me.
Yes.
We need to increase the volume on many of these people. We're having trouble hearing them.
Are you having an issue hearing me?
You'll have to speak up, folks.
Okay. Representative Santo Nastazo.
I'm here. I'm alone, and I'm in the town of Hinsdale.
Okay. Representative Schmidt.
I'm present at my home office and I'm alone.
Representative Schuett.
I'm present at my home in Pembroke alone.
Representative Schultz. Representative Schultz, you're muted.
Yes, sorry. I am here in my home and my husband will be in and out of this room, which is the kitchen.
Representative Yakubovich.
I'm here at home alone.
Representative Sytek is arriving later. I'll check him in when he comes in. I'll call again. Representative Bailey.
I am alone at home in Milton.
Representative Fontenot.
I am home in Rochester and my wife is in the house.
Thank you. Representative Goley. Okay, he was here earlier, so I'll just wait until he arrives. Thank you. Roll call is complete.
Madam Chair, I'm not going to be able to hear what's going on testimony unless we get the volume turned up. Partly it's this thing, but it's just the volume's not enough, at least for me.
Okay.
Thank you.
I would also like to say that the representative that just spoke, I could hear him very well. But Madam Chair, I hear you, but it's kind of echoes. It's a little hard to understand and it's not very loud.
Is that better?
That's better.
Yeah, that's better.
I think everyone just has to get the mic closer.
Yes. Okay, thank you. Ms. Sparling, if you could find out how we turn up the volume here for the participants, we will need that because I was having a great deal of trouble understanding the members.
I am texting Scott Kelly right now.
Okay, thank you.
You're welcome.
So our first bill, 536, I have 3 people interested in speaking. Representative Schuett, you're first.
Madam Chair, this is Representative Groda. If we could, please, I'd like to admit Representative Goley to the roll call. He had to reboot his program. Representative Goley.
I am here, home alone, here in a room alone, and my wife is in another room.
Thank you. I'm sorry for the interruption.
Oh, that's fine. While we're interrupted, who is not here?
Representative Sytek and Representative Pearson and Representative Judy.
Okay.
I'm keeping, yeah, I'll keep an eye on them.
Thank you. Representative Sytek will be here physically sometime around 10 o'clock. Representative Pearson will be calling in. I don't know about Representative Judy.
Thank you.
All right. So Representative Schuett, you have the floor.
Thank you, Madam Chair. I would note, however, that the prime sponsor is Representative Schultz. If she wished to go first to introduce the bill, I would defer to her.
Representative Schultz did not sign up to speak.
Oh.
Or I would ask you to speak.
Madam Chair, I actually did sign up last night. I don't know why it's not on your sheet, but I believed I signed up.
Okay.
So
This is a learning experience. Representative Schultz, please speak.
thank you, Madam Chair. Thank you. I'm here to introduce HB 536, a one-time death benefit for the beneficiaries of Public Works employees. This bill was inspired by a family who lost a father, a husband, and they hoped that no other family would encounter the financial difficulty that they encountered after the loss of their family member. this also is a bill that adds the importance of how dangerous of a job public works jobs can be. A year and a half ago, a public works memorial was installed in Concord, and also recognized that public works employees are first responders, public servants who put their lives on the line for our safety. And this bill would be parallel to the ones we passed recently for other professions. And it was passed in a bipartisan manner in both chambers. From this committee, a year ago, passed 15-4, and then the House on a voice vote. In the Senate, when it was voted upon on its own, separate from the omnibus process, the vote was 23-1. And so I'm very pleased to bring this bill back. And I'm also pleased that Susie Nord will also be with us today from the National Council on Occupational Safety and Health, who brought this family to my attention. So it's an honor to bring this bill back, and I hope that it will have your support. Thank you.
Thank you. Are there questions from the committee?
I have a question, Madam Chair.
Yes, Representative Schmidt.
Thank you. Just a moment while I turn on my video so that I'm not invisible to the other members and attenders. I think it's important to know that the testimony, in addition to what Representative Schultz has just indicated, spoke about the fact that these people, she already mentioned, they are first responders, and that they are subject to considerable danger out on the roadway. In many cases, are operating heavy equipment.
Your question is.
So I'm wondering what the opposition. First question: what was the opposition, if any, to this bill when it was heard in our committee last time?
I don't remember. I do know that the majority of folks voted for it, and the 4 who voted against, I don't know. I don't believe there was a minority report.
Follow up. Follow up.
There are 4 other people wishing to testify, Representative Schmidt. Perhaps they will answer your questions.
May I ask, it's a simple question. What kind of numbers are we talking about that would be entitled to this benefit if it were provided?
That's a very good question. I would hope 0. Unfortunately, this profession in New Hampshire, approximately 1 person dies every year or 2. It depends, it's a matter of accident.
Okay,
Thank you.
Representative Schuett.
Thank you, Madam Chair. Can everyone hear me all right? Okay. I will just add that I served on the subcommittee that worked on this bill last term, and we had several meetings to address various questions, particularly pertaining to some of the language in the bill. We met several times and ended up crafting a bill that, as Representative Schultz said, passed this committee, then ultimately passed both bodies, House and Senate. Unfortunately, it got rolled into one of the omnibus bills, and its fate became clouded due to that. But I personally felt that it really, we worked on it enough to get it crafted to the point where it was going to do the job. I will state in answer sort of to Representative Schmidt's question that we did hear that there were perhaps 1 or 2 employees a year, one employee every year or two who would fall into this category. And I would point out further that the language in the bill states that it's going to be up to the commissioner of the Department of Safety to investigate each one of these deaths to be sure that the circumstances fit the qualifications that are required by the bill. So it's not just going to be, oh, this guy died by the side of the road, he gets the benefit. It will be investigated. And part of that is due to the fact that we heard from the family members who testified previously that that was one of their concerns. They never really got details about how their loved one died. So in addition to the death benefit, this will provide a little closure for those families. I think that's about all that I have, unless there are further questions.
Excuse me, Madam Chairman, I do have a question, if I may, Representative O'Brien.
Go ahead.
Thank you for taking my question. When you say that the commissioner is going to investigate every single one, will there be prejudice? Because accidents do happen, such as in the example, if this employee wasn't wearing his safety vest or something like that, would that make him thus ineligible, even though the tragedy did exist and may be beyond the cause of the safety vest?
I would say, Representative, that would be one of the considerations that the commissioner or whoever he assigns to investigate the accident would look into. If someone were negligent and contributed to their own death, I'm sure that would be taken into consideration. Our main concern is the fact that right now at the scene of an accident, you have usually police and fire people cleaning up afterwards. If a vehicle comes by and plows into them, they get this benefit. But the public works guy who is there sweeping up the glass in the street gets killed in the same accident, and his family doesn't get the benefit.
Thank you.
All right. Seeing no other questions, I'd like to call Marty Carlin from the retirement system.
And Madam Chairman, this is Pam, just to interject while you're sort of between speakers. I wanted to let you know that Representative Judy has called in, but I'm unable to promote him to the panelist side because I believe he called in using the public attendee phone number. So I can enable him to speak from where he is, or I'm also sending him, I'm hoping he's listening, I'm sending him his personal the information to call in and become a panelist. So I just wanted you to know that.
Good morning, everyone. Madam Chair, I am here.
Excellent.
Jean Judy.
Good. Do you have video capability?
I try, but I see myself only, but I don't have any audio.
Oh. All right, thank you. We'll have to talk.
Yes, I'm on the phone right now.
I made it to the participant side. If I should start speaking now, Madam Chair. This is Marty from NHRS.
Good morning, please.
Thank you, Madam Chair. For the record, my name is Marty Carlin, representing the New Hampshire Retirement System. Just as a technical matter, I just wanted to let the committee know, you probably know this from yesterday, but there's a little bit of a lag when you're moving from the watching side to the participating side. So that's why there was a little dead time for my mic. I just want to speak to, there's two parts to this bill House Bill 536. The first and most prominent piece is the death benefit, and that I just wanted to clarify that that is not a New Hampshire retirement system benefit. That's a separate statute. And just to speak briefly to Section 2, which does affect the retirement system in a very small way. This Section 2 of the bill removes a offset to a death benefit paid to a beneficiary if they are also receiving a monthly benefit from workers' comp as a result of the death. That offset only exists currently for Group 1 members. It already is, it doesn't exist for Group 2. So this bill would bring parity to Group 1 and Group 2, by removing the offset from Group 1. Currently, no one is affected by this offset. Fortunately, there aren't a lot of line of duty deaths in Group 1. So it wouldn't have a significant fiscal impact, removing this provision. And typically, folks, the beneficiaries may be receiving a workers' comp benefit for a period of time and then settle and receive a lump sum. So it isn't a very big occurrence for us to apply this offset. Talking to our veterans in the benefit side, they can probably count on one hand how many times this has happened. So this is a very minor change to our law, and it only creates parity between Group 1 and Group 2. I'd be glad to answer any questions if anyone has any.
Yes, Representative Roy.
Thank you for taking my question. When you say parity between Group 1 and Group 2, does that mean all members of Group 1 or just the members who would fall under this death benefit?
Thank you, Representative. This would affect all Group 1 members who die in service of an accidental death.
Thank you.
Seeing none, thank you very much, Mr. Carlin.
Thank you.
I'd like to call on the Honorable Susie Nord.
There we go. I was muted. Good morning, Madam Chair, members of the committee. Thank you so very much for allowing me this opportunity to testify on House Bill 536 today. I work for the National Council on Occupational Safety and Health, as Representative Schultz said, and our mission is to advance worker health and safety through training, education, research, and advocacy. We support House Bill 536 because while there is no monetary amount which can compensate families for the loss of a loved one, all families experience financial disruption when a loved one is killed on the job. And I have written testimony which I will email to the committee, and I don't really want to read that. However, there were 2 points in my written testimony that I would like to make. One is that the state of New Hampshire has acknowledged for decades in Department of Labor administrative rules that public employers are responsible for ensuring a safe workplace, but they've only recently put this responsibility into statute. It's in RSA 277:1B5. But unfortunately, we don't have a comprehensive system to ensure that public employers follow generally accepted safety procedures as organizations in the private sector are required. And because of the lack of resources devoted to training, oversight, and whistleblower protections, public employees are actually at greater risk of injury, death, and illness than their counterparts in the private sector. And then the other thing that is in my written testimony that I wanted to point out is that public works employees are defined as first responders in Section 2 of the Homeland Security Act of 2002. I think it's Section 6 US Code 101, because they provide immediate support services during prevention, response, and recovery operations. And so this bill adds public works employees to the list of first responders entitled to the death benefit under RSA 21. You guys probably know this better than I do. So, but I really, I wanted to spend a few minutes this morning talking to you about my friend Allison Wooten, who could not be here today, because of work responsibilities. And she said she travels a lot for work, and she said she would try to listen. So I hope she is okay with me speaking on her behalf. She did send me an email with her thoughts on this bill. But what I wanted to do is to begin by telling you how I met Allison Wooten. I met her in 2017. I was at that time working for the New Hampshire affiliate of my organization. And she and her children and other members of her family came to a memorial dinner that the New Hampshire Kosh and other Kosh groups and organizations around the country hold the last week of April, which is considered Workers' Memorial Week, to commemorate the specific dinner in New Hampshire is to commemorate those New Hampshire workers who have been killed on the job. And we invite families that we can reach. It's not an easy task to track down everybody, but to attend a memorial and let them know that their loved ones are not forgotten. And the thing that I remember so specifically, this was in April 2017, and Allison's husband, Tom, died on the job in July of 2016. So this is 10 months later. And yet what I remember was this sense you could almost touch, but you were afraid to touch them because their pain was radiating off of them. The pain that this family felt. Now, obviously it was somewhat heightened because of the circumstances, but, and I remember at the time I had only really started working with the families of workers killed on the job not long before. And I remember being afraid to even speak to Allison because I didn't want to break her. She just seemed so fragile. And so, and she didn't stay long, I'll admit, and she cried anyway, even though I hardly spoke to her at all. And, but what I've come to learn is part of the grieving process is to talk to people about their loved ones. And I have talked at length with Allison Wooten and her daughter, Samantha, about Tom, who was a worker for the Northfield Department of Public Works when he was acting as a flagger on July 21st, 2016. And the Public Works Department, several members were moving a trailer from one place to another. And they did this twice a year. And instead of putting the trailer on the back of a truck designed to carry this type of trailer, the Department of Public Works, in an effort to save money, carried the trailer between two bucket loaders, like two trucks like this. And it was, going down the road. And they had Tom and I believe another gentleman who were wearing their safety vests, by the way, flagging traffic around this because it was a very slow moving, obviously. And something came loose and Tom went to secure it and he was crushed between the trailer and the truck that was carrying it. And as a person who works in the field of workplace safety and health, there are a lot of things that I can say about this that I won't because it's not appropriate to this situation. However, make no mistake that Tom's death was a workplace fatality. It was a workplace trauma. And he has become a statistic. And so I don't want him to remain a statistic for you because this bill really is about people, and it's about how do you make up for the loss of a human being, of a human life. And Allison and Sam have become friends of mine, and I'm friends with them on Facebook. And because of that, I've seen posts that they have on Tom's birthday or on the anniversary of his death, and I feel like I know him a little bit. He was an avid sportsman. He liked snowmobiling and hunting and fishing. And he was handy. And he and Allison came to New Hampshire because it was their dream to live here in New Hampshire. And his job at the DPW was sort of a semi-retirement job that he enjoyed a lot. He got to use a lot of his skills and abilities, and and he didn't.
Yes, thank you. Ms. Nord, I've muted you because although this is fascinating, it's not really relevant to the bill. So would you please confine your testimony to how it affects this particular bill? Thank you very much.
Certainly, Madam Chair. And I guess I believe that it is relevant because it's to understand the loss that families experience. And it's not just a financial loss, although Allison did lose Tom's income. And then when she was in this situation of trauma where her husband had just been killed and her entire life plan has been disrupted, she's asked to make a choice between accepting workers' compensation payouts or pension benefits, or, there are so many decisions that come at these families. And not only are they in a financial pickle, many of them, from the loss of income from the person who was killed on the job, but they are also in an emotional state that is very fragile and delicate. As any of you, I'm sure, can imagine, it would feel to lose your father, your spouse, any loved one, really. And so this bill does not make up for what Allison lost. It can't. There is no person, and I've spoken since that time that I met her, I've spoken to countless family members who have lost a loved one tragically in a workplace fatality. And not a single one of them says, yeah, I got $100,000 from the state because my husband was killed. But what this can do, and Allison, the reason that she asked me what she could do, and I approached Representative Schultz, is that this bill acknowledges that there are financial repercussions, and it acknowledges that the person who worked for us as a community, public workers, public employees, that they have value and that their work has dignity, and that we as a state appreciate and respect that. And I apologize for my tangent. And I will take any questions. I will do my best to answer them.
Thank you. Are there any questions? I don't see any, so thank you very much.
Thank you, Madam Chair.
Excuse me, Madam Chairman, can I just interject quickly on Representative Judy? I have muted him because I think there was sound in his background. But Representative Judy, if you would like to unmute yourself, remember *6 is the way to do that, and *9 allows you to raise your hand. Thank you. I'm sorry for the interruption.
Is there any?
This is Representative Rhoda. Representative Pearson has joined the hearing. Representative Pearson, could you please acknowledge yourself for the roll call vote? The roll call attendance.
Acknowledge myself. I'm not sure how one does, so I'm here.
And you are where exactly physically?
I am physically in the city of Manchester right now.
And you are by yourself?
I am by myself in my office at this time, yes.
That's all you need to do. Thank you so much.
You got it. I'm not accustomed to things starting before 10 o'clock with committee work, so I apologize for my tardiness.
I apologize for starting early. All right, I don't see any other hands, so I will close the public hearing on House Bill 536 and move on to the hearing on House Bill 591. I will call Representative Lang to introduce the bill. And
Madam Chair, is Representative Baptist on?
I'm going to send, no, he's physically in the building. I'm going to send someone over to ask him to stop by. Representative Letchis, could you do that?
Sure.
He's, in 202.
Madam Chair,
Yes, Representative Schultz.
I see someone did have their hand up from the attendees section before you adjourned that hearing. I didn't know if he was speaking on that bill. I believe he was. I just wasn't quick enough to bring it to your attention. I apologize.
Yes, I. All right. Yes, I don't know if these people are here for 536 or for House Bill 91. So I will invite them and ask them to tell us which they are here for. There's two. Okay. Mr. Gulla, which bill are you here for?
Good morning. I'm here for 536. I did register to speak earlier, so I apologize. I didn't raise my hand.
After I got the list of attendees, so I apologize for not noticing.
That's okay.
Please speak on 536.
Thank you. Madam Chair, members of the committee, for the record, my name is Richard Gulla. I am president of the State Employees Association of New Hampshire, and I ask for your support of House Bill 536. I thank you for bringing this back last session. The reasons why this bill passed the House last year are even more evident this year in COVID-19 world, where we are so dependent and thankful for every first responder who has stepped up and provided all of us the services needed to keep us safe while we work through this incredible pandemic. As written, 536 adds public work employees to the list of job professions eligible for death benefits for those killed in the line of duty, based on the criteria as laid out in RSA 2129A. The important lines and definitions added are on page 2, lines 29 through 34, which clarifies the duties in which public work employees would be considered for the death benefit. Clearly, the bill recognizes the work of the public works and highways personnel working in hazardous locations and as first responders, or working with the first responders in construction zones or other highway work. Highway workers typically are working within a few feet of cars and trucks, traveling at high rates of speed in support of police and other medical first responders in accident scenes and other traffic control emergencies. Often, highway maintainers are the first on the scenes of deadly accidents in New Hampshire. I have listened to the highway workers retelling of chilling near misses of cars speeding by within inches at 75 miles an hour and more, while they were setting up cones to divert traffic away from a crash site. Highway workers understand the dangers of the job and they take as many precautions as possible, but they cannot control the distracted drivers and other accidents which occur from time to time. For our highway workers, it is just part of the job they accept. House Bill 536 recognizes that as first responders, we should provide some protections for those families who have suffered the loss of a spouse who was killed in the line of duty. Public work employees are classified under Homeland Security Presidential Directive 8 as first responders and have been recognized as crucial to providing safety and support to our police, fire, and medical personnel on our highways, and should be included in providing the same death benefits of other first responders. I want to thank you for the time and consideration of this needed legislation. Please support passage of House Bill 536 and provide our public works employees the same respect and support as we do other first responders. I thank you.
Thank you, Mr. Gulla. Are there questions from the committee?
Madam Chair, this is Representative Groda. I would like Mr. Gullia, please, to send us his written testimony.
I will do that.
Thank you.
Thank you.
All right. Thank you, Mr. Gulla.
Thank you. Good day.
Okay. Mr. Rodriguez from DOT.
Yes, good morning, Madam Chair and members of the committee. My name is David Rodrigue. I'm the Director of Operations for New Hampshire Department of Transportation. I want to start by saying the Department of Transportation strongly supports this bill. I will not reiterate what others have said, but a little more information. DOT and the public works industry in New Hampshire are committed to the safety of all of our workers. However, there is no doubt when conditions beyond our control, such as hurricanes, snowstorms, and other events, when we are telling everybody else to stay home, we tell our people to come to work and clear the roads and make our infrastructure safe for all of the people of this state. Many of our people work next to high-speed traffic, a few feet away from motorists who refuse to slow down, move over, put their cell phone down, and pay attention to what's going on the road. An industry group leader, Environmental Health and Safety, lists the top 10 most dangerous occupations. Of these jobs, public works employees and DOT employees do 8 of them. We do 8 of them. So the number 10 most dangerous job is landscaping. Town, cities in the state, DOT, we do plenty of landscaping. Number 9 is the construction trades. That's what we do day in and day out. Number 8 is structural steel. Our bridge maintenance crews, your state DOT bridge maintenance crews are working with structural steel on a regular basis. Number 7, farming and agriculture. No, I won't take credit for farming and agriculture. That's one of the 2 we do not do. Number 6, truck drivers. We log millions of miles every year on the roads, whether it be plowing or getting to our work, which is on the roads. For us, a truck or a vehicle is a tool to to do our job on the roads, not simply to get us from place to place. Number 5 is garbage collectors. Our municipal public works crews are all out doing that. Number 3, aircraft pilots, other than one at the DOT who occasionally flies. That's not an occupation I'll take a lot of credit for. Number 2, fishing. That's one that we don't do. And number 1, logging. That's a big part of our job, cutting trees, clearing trees, and so forth. So when we ask why public works employees, why are we considering them? I want you to consider two reasons. I said more accurately, 7 of the 10 most deadly occupations in the world are part of our routine tasks. That's reason number 1. Reason number 2 is when conditions are at their worst, when the rivers are raging, the roads are washing out, the floods are coming or have come or we're in the middle of, and we're telling everybody else to stay home, your public works and DOT folks are coming to work to safely close those roads, reroute traffic, and do what's necessary to keep the public safe. So I thank this committee very much for taking up this important legislation. $100,000 is a lot of money, but it's a drop in the bucket when you lose what could be the primary bread owner of a young family with children growing. So thank you very much for your consideration, and I'll take any questions.
Thank you. Representative Schmidt, do you have a brief question?
Madam Chair, did you call my name? I didn't quite hear you.
Yes, do you have a question? not a
I
speech.
do. I just would like some corroboration. Likely to be in the category covered by this bill. I believe Mr. Gullah would be the answer the question. I raised my hand for him.
Excuse me, Representative Schmidt, he did specifically say that it's in the bill on page 2, starting on line 29.
Okay, very good.
Thank you. Mr. Durkin? Oh, sorry, you can't tell him yet?
There we go. Can you hear me, Madam Chair? Thank you. Thank you very much. Jim Durkin, representing ASME Council 93. We have about 4,000 members in New Hampshire, including many who work in public works. And I will be very brief. There's not much I can add to what's been said, particularly from the gentleman from New Hampshire DOT. But if anybody has any doubt as to the need for this legislation, I would encourage you to take just a brief drive from the Capitol up to the New Hampshire Department of Transportation headquarters, where you'll see the Public Works Memorial and see the names of dozens and dozens of professionals, public works professionals who have been killed on the job over many, many years. I had the privilege to be at the dedication of that memorial, and I heard Governor Sununu, if he said it once, he said it a dozen times, that they are first responders. And look, you know, each occupation, each public sector job has varying degrees of danger on the job. That's clear. Some are higher than others. But the bottom line, in our opinion, is if you give your life on the job, then your life is worth as much as any other public employee. And these families really need their help. We're actually pursuing legislation throughout our 4-state region to provide this type of benefit for all public sector workers. Going back to what I just said, if you give your life, regardless of the level of danger you face day in and day out, if you give your life in the service of the taxpayer, how can somebody say to a child and a spouse of a deceased employee that, you know, one person's life is worth more than others? And unfortunately, you know, the world we live in, even in education, you know, what about, you know, God forbid, in the case of a mass shooting in a school, what about the custodian or the teacher that throws themselves in front of a student to save their lives? So we're delighted to see this legislation filed, and I thank you for the opportunity to speak today.
Thank you, Mr. Durkin. No other hands. So I am again closing the hearing on House Bill 536. I want to learn how to better learn and reopen the hearing on 590 on House Bill 91 and call the prime sponsor, Representative Abbas. Bring in a chair. They're on wheels.
Madam Chair, I'm so sorry to interrupt, but Representative Sytek is here.
Yes,
so I'd like him to acknowledge his presence for the roll call attendance.
I'm here.
Thank
you. And Representative Sytek, are you ready to take the minutes for the bill? This bill, would you like me to continue?
No, I'll take it over.
Thank you for your service, Representative Griffin.
My pleasure.
Whoop. Just carefully set it down on me.
Those at home, Representative Abbas is strong.
I apologize to the New Hampshire taxpayers for that.
It's not a like person.
I'll just stand if that's all right.
Just stand. Your choice.
I'll just leave that over there.
That's a way to make an impression, Representative Abbas.
We're going from tragedy to comedy.
We're just fortunate no one was sitting in that chair.
I'm just gonna stand if that's okay.
Please speak.
Thank you. My name is Representative Darrell Abbas. I'm from Rockingham County District 8, which is Salem. And I'm introducing this bill. It may look familiar. We did have this last year. I did pass in this committee with an off-pass recommendation with an amendment of 18-1. I believe it passed on the House floor with a roll call vote of 275 to 41. The reason why I brought this legislation, I filed this bill last year, and refiling it, is the overwhelming high frequency of suicide that we see in our first responders. I believe in 2018, it was 8 first responders that committed suicide in the state of New Hampshire, which was much higher than the average rate. And of this higher rate of suicide amongst first responders has been attributed to PTSD. Suicide is a common symptom, at least attempted suicide or suicidal thoughts are often associated with PTSD. And the reason it's PTSD is associated with the high stress related to first responders line of work. What this would do, it creates that presumption that if a first responder were to pass away by way of suicide, that it would be considered to be related to their profession. There's no difference in if a first responder suffered a physical wound, but subsequently succumbed to that wound several months later. That can be considered a line of duty death as well. We do have presumptions like such as with workers' comp involving. We passed a bill 2 years ago involving firefighters who get diagnosed with cancer because of their exposure to potential hazardous chemicals. There was a presumption that the cancer was related to their line of duty. This policy was been adopted already by the United States military, and so it's been implemented and used before. And I understand this bill. Some of the concerns I often hear with this bill, and at first glance, is that this bill would reward or encourage suicide. And I believe that's a fair question, and I don't fault anyone for asking it. But I will say that based on what the line of duty death benefits are, if someone were to do the math, I will say that often someone who is suicidal, from what I understand, they would not do the math. If they did, from an equitable perspective, they actually would, it wouldn't make sense for them to do that. Whether it's their pension paying them or whether they're working, they would make more money alive. So I don't believe that this would encourage or reward suicide by any means. What this does is it simply provides a line of duty death benefits to the surviving family of the first responder who unfortunately succumbed to their PTSD. And I'll answer any questions.
Representative Roy.
Thank you for taking my question, Representative Bass. Can you tell us the history of this bill? Was this here last year, and how did it fare?
So this was filed last year, in the second year of the last term. It was amended in this committee. It did pass, it was an opt to pass with an amendment recommendation of 18-1 in the committee. And then we actually voted on this, I believe, on the marathon session we had at 4 a.m. I think we voted on it. And that day, it didn't pass. It was a roll call, and the roll call vote was 275 to 41. It then went on to the Senate. It was never acted on in the Senate because of the COVID-19 pandemic. So this is just a refiling of that. This is the filed version with the amendment already.
And that was my follow-up. This is the amended version from last.
Yes.
Thank you.
Questions? Hands or voices, so thank you very much, Representative Abbas.
And I'll remove this chair. I apologize.
Thank you, I appreciate it. Representative Lang, do you need to testify?
I do not, Madam Chair. Thank you. Just in support of the bill.
Thank you. Chief Goldstein, if you'd unmute yourself.
Cheers.
Are you able to hear me?
Yes, we hear you fine.
Thank you. Good morning. Good morning, Madam Chair, members of the committee. For the record, my name is David Goldstein, and I am the Chief of Police in the City of Franklin. And today I represent the New Hampshire Association of Chiefs of Police, and we support HB 91. A historical note, and I believe Representative Abbas may have mentioned this, is that last year, under the guise of HB 1122, Your committee passed this bill after a public hearing. It also passed the full House 275 to 42, but due to COVID, never made it to the Senate. Also, for the record, I'd like to lay a little bit of a foundation as to why I feel I can testify for both the chiefs as well as law enforcement in general. I've been a police officer for 41 years. I have a bachelor's in psychology, a master's in public health with a concentration in mental health issues, a second master's in counseling, and a PhD in counseling with a concentration in criminal justice and the study of trauma. I'm a diplomate and fellow of the American Academy of Experts in Traumatic Stress, and I'm board certified in forensic traumatology. I'm a member of the Southern New Hampshire Critical Incident Stress Management Team and Peer Support Team, which deals primarily with law enforcement, as well as being an active member of the Granite State Critical Incident Stress Management Team that deals with law enforcement, fire, EMS, and now we have expanded into hospitals and work with physicians, nurses, and paramedics. I'm a full member of the International Critical Incident Stress Foundation. I've conducted empirical research on the association between smoking behavior and self-destructive behavior at the VA hospital in Boston. I authored and published a 477-page dissertation concerning mental health services for law enforcement. I have authored a number of peer-reviewed articles in stress, crisis, and trauma, and I hold adjunct positions, professorships at Boston University, New England College, and NHTI. I'm also an adjunct instructor at our academy, have been for over 35 years in the area of stress and crisis, as well as being an adjunct instructor at the Reading, Massachusetts Municipal Police Academy. It is our belief that this is a very laudable and necessary bill, and the research that supports it comes from the PERF, which is the Police Executive Research Foundation, the IACP, the Bureau of Justice Administration, New York Police Department, National Alliance on Mental Illness, NAMI that is, National Symposium on Law Enforcement Officer Suicide and Mental Health. Also, there are a number of articles out there, researchers and authors that draw a distinct correlation between the stresses and strains of police work and all first responders and the acts of suicide. And these numbers are growing every year. For example, in 2019, we had an all-time low in the nation of 89 line of duty deaths for police officers. However, we had an all-time high of recorded and authenticated 228 law enforcement suicides in the country. And is also, I believe Representative Abbas also mentioned the fact that the United States military has recognized the necessity of paying out benefits to survivors. And in the military, it's a $400,000 payout for the survivors of a suicided military member. As far as other first responders are concerned, there's a study out, a recent study that shows that more firefighters themselves died by suicide than in the line of duty deaths beginning in 2017. It found that 103 firefighters and 140 police officers died by suicide that year, compared to 93 firefighters and 129 officer line of duty deaths in 2018. In closing, we would ask simply that the committee find this bill ought to pass, and I'm happy to answer any questions the committee might have.
Representative Fellows, got a question?
I'm sorry. I should have taken my hand down. It was a question for the last bill, the last speaker. Is he still around, or by any chance?
I believe so. Please ask your question.
My question was last year or 2 years ago, the eDNA added a sentence into that bill, and it's still there in the current version of the bill. And I just wanted to ask him if he felt comfortable with that sentence, or if maybe he maybe thinks it's can cause some issues in terms of defining when the benefit should apply.
Chief Goldstein?
I'm actually not familiar with which sentence you're referring to, but I do have the bill in front of me. If you could give me a specific reference.
I'm sorry. That question was intended for the prime sponsor.
Representative Fellows, Representative Abbott specifically said that he chose to submit the amended version, and that's what this is. He supports it.
Okay, thank you.
Representative Roy has a question for Chief Goldstein.
Thank you for taking my question, Chief. It's my understanding there's currently a death benefit, a federal death benefit for police officers killed in the line of duty. And if that's correct, does it currently recognize suicide or not?
There is a death benefit. Quite frankly, I don't know if it does. I can certainly find out for you and would be happy to provide that for the committee.
I appreciate it only because it would be helpful with us if it does. Thank you.
Thank you. Seeing no other questions, I'll call on Mr. Norton or NAMI.
Thank you, Madam Chair and committee members. My name is Ken Norton, and I'm the Executive Director of NAMI New Hampshire, the National Alliance on Mental Illness. And on behalf of NAMI, I'd like to speak in support of House Bill 91. Just by way of background, I led the development of NAMI New Hampshire's Connect Suicide Prevention. And in response to suicide program, we respond after suicide deaths. And we've trained in over 40 states and 40 tribal nations in 6 countries. I've provided briefings on suicide and suicide response at the Pentagon and served as a subject matter expert to the Department of Defense, the Substance Abuse and Mental Health Services Administration, the Veterans Administrations, and others. Closer to home, I've been involved in the state legislatively established Suicide Prevention Council since its inception, on the Commission on First Responders and Post-Traumatic Stress, and I was on the Governor's Law Enforcement Accountability, Community, and Transparency Commission this summer. NAMI New Hampshire provides 16 hours of training to all cadets coming through the police academy. And we're also currently providing training for state police and fire and EMS, 40-hour crisis intervention training and an 8-hour mental health first aid training through a federal grant. All of that training includes information about their own mental wellness. And I first taught about suicide of police, not just by police, at the Police Academy in 2008. We've continued to do that since then. Chief Goldstein is a tough act to follow. I don't have much more to add than what he has said, other than that, you know, the current Department of Defense policy is to pay a death benefit, and that is not narrowly interpreted to mean the person is on duty at the time of death. And I believe that's the additional sentence that was added to, by this committee last year. And, you know, would reiterate the information he said about the numbers and also which are more closely, I think, aligned for law enforcement, but we're starting to get a better handle on fire and EMS, and those numbers are quite high as well. And just that first responders risk their lives every day, often placing their well-being before that of their families for our well-being. And families are the hardest hit by a suicide death, and I would urge you to support House Bill 91. I have written testimony, and I'm happy to answer that. I'll submit. I'll be happy to answer any questions you have.
Thank you, Mr. Norton. Representative Schuett, you have a question?
Yes, thank you, Madam Chair. I apologize. This just occurred to me, and it may possibly have been better directed to the previous speaker, but I was curious if Mr. Norton could tell us what kind of access to counseling do these employees have for PTSD or whatever issues may be bothering them?
Thank you for your question, Representative. It's a great question. I will do my best to answer, but Chief Goldstein may have some information as well. One of the biggest challenges that we face is a culture of not asking for help among our first responder community, and some of that is historical in nature relative to the jobs that they have and the perception that if they ask for help that it could negatively impact on their careers. There's been a lot of effort to change that. Chief Goldstein is and has been a leader in our state around that. But there are, first of all, for anybody that is a state employee, for instance, in fire or EMS, there is employee assistance programs, and I believe most departments have that as well. But more importantly, what's been developed in the last few years, particularly among the law enforcement community, but now starting to see for fire and EMS, are peer support programs where trained police officers are not trained not to be counselors, but to be peer support for their fellow officers. There was legislation passed that provides confidentiality for that. So there's an extensive and building network of peer support within the state. There are also specialized inpatient units. For instance, McLean Hospital in Boston has a first responder inpatient unit that's exclusive for first responders needing inpatient psychiatric care. And then Chief Goldstein also mentioned, and he's been a lead on the critical incident stress debriefing teams, and they will respond after a critical incident to provide support and debriefing. And again, it's predominantly peers to some of these different departments.
Thank you very much. I know it's difficult for particularly police and firefighters who deal with deaths of children many times on the job. And I know that's one of the issues that's very tough to deal with.
Thank you, Mr. Darn. Are there any other questions? Okay. Seeing none, I'd like to call Mr. Wilson.
Good morning. Thank you, Madam Chair and the members of the committee. My name is Gordon Wilson. I am testifying in support of HB 91. Currently, I am the coordinator of the Professional Firefighters in New Hampshire peer support team, and I've been a member of Nashua Fire Rescue and Nashua Firefighters IAFF Local 789 for the past 27 years. I currently am assigned to Nashua Fire Rescue Station 4, where I serve as station captain. I also represent the professional firefighters in New Hampshire on the commission to study incidents of post-traumatic stress disorder in first responders. During my remarks, I'm going to focus on firefighters and the family of firefighters, but this in no way detracts from the serious effects suicide is having on our other first responders and their families. I've been affected both personally and professionally by firefighter suicide. I have friends that have completed suicide, and being a firefighter peer supporter, I have learned more than I ever thought I would about firefighter suicide. For me, HB 91 is not just about the members we lose to suicide. It is about their families and helping to take care of a family that has suffered a devastating loss. A family quite often makes sacrifices due to the nature of the job and the impact it has on family life. I have also witnessed the toll that suicide takes on other members of their fire departments. Oftentimes, their first thoughts are of how they can help the family and to help make sure the family is supported both emotionally and financially. The passage of HB 91 will help to alleviate some of the stress, worry, and grief of firefighters suffering with the loss of their friend and fellow firefighter. Knowing that the family will receive the line of duty death benefit. Research shows that rates of PTSD and acute stress are high among firefighters. Research also shows that firefighters suffer with PTSD have higher rates of suicide as opposed to the general population. Through the passing of the PTSD bill for first responders, and the state of New Hampshire has made, sorry.
Are there any questions?
Can I just, would like to add a little bit more. As this time researchers acknowledge there is very little data on firefighter suicide and its effects on family and the community. This may be a result of the stigma surrounding suicide. The PTSD bill and HB 91 will provide much needed assistance in the short term. In the long term, my hope is that by the state of New Hampshire recognizing the problem of firefighter suicide through passing HB 91, more data will be made available by families and fire departments for further research into firefighter suicide. This will lead to better suicide awareness training and suicide prevention for other states, for our state's first responders. I urge you all to support HB 91. Thank you.
Thank you, Mr. Wilson. Are there any questions from the committee? Seeing none, I would like to call Mr. Rill.
Madam Chairman, I do see Representative Schmidt's hand up.
Yes, indeed. Thank you, Mr. Rill. Pause for a moment.
I just wanted to thank Mr. Wilson for the written testimony he provided, which was very illustrative and helpful. So thank you very much, Mr. Wilson. I'll recommend his written testimony to my colleagues on the committee.
Representative, Mr. Rill, please.
Thank you. Can you hear me okay?
Yes,
Yes.
Thank you, Madam Chair and members of the committee. My name is Brian Rill, and I serve as the president of the Professional Firefighters of New Hampshire, and I'm a captain for the City of Portsmouth Fire Department. Professional Firefighters of New Hampshire is a state association that represents 42 local unions and approximately 2,000 active and retired professional firefighters and paramedics across the Granite State. As the preeminent firefighter organization in New Hampshire, we advocate for the health and safety of the brave men and women that protect the citizens of this great state. In the fire service, we're routinely called to scenes of catastrophic incidents involving severe injuries, tragic loss of human life, and property loss. I testify before you today in support of HB 91 relative to the death benefits of first responders who die from suicide. I would ask that you see my written testimony that I've submitted more in depth on this subject. But I do want to talk about a little bit about the bill here. In the fire service culture, we have long been expected to portray a tough guy image. The iconic scene of firefighters doing the hard, physically demanding, and dramatic work easily comes to mind. And this is oftentimes contrary to what the men and women in this fire service are truly feeling and experiencing. The PTSD, the nightmares, and the depression, just to name a few, all have a cumulative effect on the body and the brain. According to the Journal of Occupational Health, approximately 20% of firefighters and paramedics have PTSD. According to a 2015 Florida State University study, nearly half of the firefighters surveyed, which was about 46.8%, have thought about suicide. 19.2% of those had suicidal plans, and 15.5% had made suicide attempts. Because of this impact on firefighters, we have worked tremendously hard to provide more support in this area. In 2015, the International Association of Firefighters, known as the IAFF, received funding from the Department of Homeland Security to begin developing a comprehensive, evidence-based peer support program for its members. We have created a peer support program much like this here in New Hampshire that's made up of fire service peers and mental health clinicians. And you heard about Brother Wilson's testimony on this very subject. This focuses on active listening skills, suicide awareness and prevention, crisis intervention, referrals to local resources, and relationships with local behavioral health care providers. The program has been invaluable for many of our members who have been battling a wide variety of behavioral health issues. And again, I welcome you to look at our written testimony where you'll find more details on this program specifically. We do recognize that we have far more work to do in regards to awareness and prevention, but we believe that we've built a strong foundation with this program. Unfortunately, tragically, we continue to see many of our brothers and sisters continue to lose their battles with post-traumatic stress disorder, oftentimes resulting in an increase in harmful behaviors that include substance abuse, self-harm, or suicide. We face the harsh reality that despite our best efforts of awareness and prevention, in providing a helping hand, or a shoulder to cry on, there are simply some instances where we're unable to make the save. And in these instances, our responsibility turns to the families of those loved ones lost. Those are the very same families who support their loved one throughout the many nights, weekends, and holidays away from home, many times 24 or 48 hours at a time. We owe it to these families to provide some level of dignity and relief in their life. And while it won't bring those loved ones back, it will help to ensure those families can begin to heal. The leaders of the professional firefighters in New Hampshire vow to continue its fight to educate our members, reduce the stigma surrounding behavioral health, and prevent any further loss of life to this devastating illness. Until such time that we can win this fight in its entirety, we ask this committee to move to support HB 91 relative to the death benefits of first responders who die from suicide. I will be happy to answer any questions. I did just want to address one question that was asked earlier about the federal benefit. And currently the PSOB federal benefit does not include stress or strain as it relates to post-traumatic stress disorder and injuries resulting thereof.
Thank you. That's good information to have. Are there other questions from the committee? Thank you, Mr. Rill.
Thank you.
Conti, you had your hand raised. Did you wish to speak on this bill?
Yes, thank you very much. Can you hear me clearly? My name is Russell Conti. I am currently the Mental Health and Wellness Coordinator for the Department of Safety, Division of State Police, and that follows a 32-year career where I retired as a major. I also am the chair of the State Suicide Prevention Council, which involves many entities. And I also am the board president for the NAMI New Hampshire Board of Directors. So thank you for hearing me. I don't have written testimony, but I do have a couple of comments. I think what we've heard from testimony this morning has been incredibly informative, and I think it's come from the right people. But just to add a couple of comments, I think, first of all, the Department of Safety, Division of State Police is supporting HB 91, and I really want to thank each and every one of you for the time. Representative Addis for putting this forward. This is something that clearly gets looked at, and I was involved over 15 years ago with putting a peer counseling unit together with state police, which was the first organized peer counseling unit in the state at the time. And the one thing that I think is being left out that I wanted to mention is the success stories that we have in treating post-traumatic stress and in treating, the incidents that affect all first responders and the saves that we have. And although we have had many suicides certainly in the last 35 years that I've been involved in being a first responder and public safety, there has been many more that we have helped, and especially in the last few years. So the one thing that I think came of this that I wanted to make sure everybody heard was there were several questions. Is this something that's going to push people towards, death by suicide? Is it something that is going to impact people that way? The answer, in my humble opinion, is clearly no. What we have is we have more people reaching out for help than ever. We have more help available to people. We have not only commissions, and I serve on the Post-Traumatic Stress Commission, and we were able to pass some legislation or help to get some legislation passed last year with the help of all of you. To make a presumption for post-traumatic stress as it related to workman's comp, which was enormous. And when it relates to what first responders deal with and what drives them to that desperation, to that point where, death by suicide is even something that's considered. So I just wanted to let you know that there is a lot going on. And the State Suicide Prevention Council many years ago, and I've been part of it for over a decade, started a law enforcement subcommittee, and we've moved that. And since I've chaired it, we have moved that to the first responders subcommittee. And we're also going to we're going to bring in veterans, so veterans and first responders. And the reason I say that is because there is an incredible amount of attention that this is getting nationwide for the right reasons. And you've heard testimony about people unable to talk about it, having to be the strong people as first responders, unable to help ourselves. All of those things are true. But there is a pivotal change. And I think this bill being where it is in today's society and in not only law enforcement, the fire service, EMTs, our dispatch personnel, communications personnel, all of that matters. And there could not be a more timely application of this bill. So I really implore you to fully support HB 91 and know that behind all the concern that comes from this committee and comes from the representatives that brought this bill forward are a group of people, both active, retired, and still in the first responder community that have recognized the issue, that realize what the solution is, and that are working together like they've never worked together before. So I implore you to support it. I thank you for all of the thoughts. I thank everyone for their testimony today. This has been an incredible hearing, and to get this to the point where it has, not only last legislative season, but to see it come back is really heartwarming for families, because in the end, that's really what we're talking about. It is the collateral benefit for families that have lost first responders, whether line of duty or death by suicide. And we all know that there's many people left behind, and it affects everyone. So thank you.
Thank you, Mr. Conti. Questions from the committee? Seeing none, Ms. Fredette.
Hello, thank you, Honorable Chair. My name is Ella Fredette. I am the HR Administrator for the New Hampshire Department of Corrections. I'm speaking on behalf of Commissioner Hanks, who has been called away to another matter. Her apologies, but I will speak on her behalf. I have worked for the corrections field for over almost 25 years now, and have seen corrections come into the world of law enforcement from where it was years ago. We are recognized law enforcement, our corrections officers, our probation and parole officers, along with our correctional line personnel, our law enforcement. They are in the prison environment. They are working with all the stresses, especially now with this pandemic, and are impacted both personally and professionally by suicide and post-traumatic stress and all the things that we've already heard in prior testimony. We support House Bill 91. We appreciate the fact that the tragic issue of suicide is being brought forward, and we will do what we can to be in support and be included in this bill. Thank you.
Thank you. Are there questions from the committee? Is there anyone else who wishes to testify on House Bill 91? Don't see any hands. All right, thank you very much. Close the hearing.
Madam Chair,
Yes. Representative Pearson. I believe that's you.
just for the record, I was asked to be a co-sponsor on this bill, and I did reply to OLS. And as we're very much aware right now, OLS has become extraordinarily problematic in these COVID times we're in. So although I'm not on the bill, I just want the committee to understand that I was intended to be a co-sponsor.
Thank you. In that case, I'm glad you did not ask questions. Very polite. All right. Opening the hearing on House Bill 619. I do not see the sponsors, any of the sponsors here. So would someone from the committee please introduce it?
Actually, Madam Chairman, Representative Trottier, I believe, is in the attendees list, though he's not on the sign-in sheet. He was earlier.
Can't see him.
I wonder if he left. Sorry, I don't see him.
Fine then. In that case, I will introduce the bill. This is House Bill 619, designating police and fire dispatchers as Group 2 members of the retirement system. I don't know any more than that, but I will say that I have spoken with Representative Trottier, and he has asked this committee to retain it because he has found problems with it that he doesn't think can be resolved immediately. He was working on 3 different amendments that I knew of, and therefore we wouldn't be ready to properly evaluate it immediately, but he did ask us to retain it. That's all I have to say on this bill. We do have other people. Mr. Carlin, do you have anything to say on this bill? Marty?
He's on his way.
Okay. Ms. Benvenuti, did you have anything to say at this point?
Thank you, Madam Chair. And can you hear me okay?
Yes, thank you.
Oh, perfect. Good morning, members of the committee. For the record, my name is Becky Benvenuti, and I am the Government Finance Advisor for the New Hampshire Municipal Association. And I'm here today to speak in opposition to HB 619. While NHMA recognizes the very significant responsibility carried out by dispatchers across the state and the critical services they provide, particularly over the past year, NHMA's legislative policy positions oppose any expanded benefits that would increase current or future employer contribution costs. And just referencing the newly certified employer contribution rates, which become effective on July 1st, dispatchers are currently classified in Group 1 employees, which is 14.06% of payroll is the employer cost. And that would increase if they were to be included as Group 2 police to 33.88% of payroll, or for fire to 32.99% of payroll, which is more than double the current employee rate. Taking these rates and applying them to annual wages, which could range an estimated of $40,000 to $60,000 for dispatchers, the increased cost to a town or city resulting from this legislation would range from $7,800 to $12,000 per year per individual dispatcher. And while the impact of this bill would be relatively minimal to a smaller municipality, it could be significant, very significant for larger cities who have a number of both police and firefighter dispatchers. But more concerning to NHMA is that by expanding the positions currently qualified in the retirement of police and fire for this one position, dispatchers now, it could set a precedent and open the door for future expansion of the Group 2 membership, which of course would result in even greater future additional employer costs. And with the loss of the state's share of employer costs, municipalities would be required to assume 100% of the increase in costs. And for those reasons, we respectfully request you to vote HB 619 inexpedient to legislate. That's all I had to say. Thank you very much for your time.
Any questions from the committee? Representative Allegro?
I didn't have time to do this research on my own. I apologize for that. It's a simple question. What's the defining feature of a Group 2 member as opposed to a Group 1 member?
Group 1 members include police and teachers. I'm sorry, I said police. Group 1 are employees of employees and teachers. Group 2 are police and fire.
May I follow that up?
Associated members of fire departments, such as maintenance, personnel, and dispatchers, are explicitly excluded from Group 2 at this point.
May I follow up?
Follow up.
And thank you for taking my question, by the way. But what is the, I'm not asking for a list of who's included in this group. I'm really after what are the defining features of that group? Is it risk to life? Is it hazardous materials? That's what I'm trying to get at.
It's defined in RSA 100A, paragraph 7, which defines the requirements for Group 1.
Okay, I'll find it.
We'll discuss it after the hearing.
Thank you.
All right. Thank you, Ms. Benvenuti. Mr. Durkin?
Thank you, Madam Chair. Everybody hear me okay? Once again, Jim Durkin, Legislative Director for ASME. 4,000 public sector workers are under our union in New Hampshire, including about 50 emergency dispatchers working in 12 New Hampshire municipalities and 1 county. And I'm here today on their behalf to ask for your support for HB 619, which, essentially would reduce the amount of years they'd be required to work in what is widely recognized as one of the most stressful jobs in public service. As a union representing hundreds of dispatchers in 4 New England states, we often refer to these professionals as the first of our first responders. That's because they are the very first people responsible for helping others during the most difficult, tragic moments of their lives. Retirement group classifications and the justifications behind them vary from state to state, but in general, they're based on physical abilities and emotional stress levels that ultimately lead to very real physical problems. And the goal is to provide people with an opportunity to retire and enjoy some decent, healthy years before the toll of the job results in debilitating health problems that impacts their quality of life and ultimately shortens that life. A quick example, in Massachusetts, our corrections officers are allowed to retire with 50% of their pay after 20 years, regardless of their age. And the idea is to get them into a new occupation before they hit their 50s, because if they work beyond 55, most are dead before they hit the age of 62. But most people understand that corrections and police endure high levels of stress. They don't need to be convinced, but few realize how much stress our dispatchers endure every single day on the job. Over time, that emotional stress, again, manifests itself in the form of physical ailments, heart disease, high blood pressure. It's because the day is never routine or the same. Within a single hour, they can be found handling an opioid overdose, a fatal crash, and a house fire. Then when the call ends, they're required to do it all over again every single day. And they don't just take and route the call. They're required to calm the caller as quickly as possible. And when needed, they're required to give immediate life-saving advice over the phone until emergency personnel arrive. They spend their entire shifts dealing with people in the most panic moments of their lives, and those people's lives are dependent on how quickly and efficiently they react. The dispatcher, a few seconds of delay or hesitation can mean the difference between life or death. So in closing, I want to say that a lot of our dispatchers wanted to be here to share some of their stories, but most are either on the job now, resting up for the second shift, or sleeping after a long shift. So I'll end with one story told to me years ago that still haunts me to this day. This particular dispatcher took a call from an elderly gentleman who awoke from a fire alarm and called 911 to ask for help because his only exit from his third-floor apartment was blocked by the fire. The dispatcher told me he knew there was no hope for the man. So he stayed on the line with him. He listened in horror and agony to his screams until the fire took him and the line went dead. And I'm sorry to burden you with the story, but I felt compelled to tell it with the hope that it'll give you some understanding as to why this legislation is needed and why these brave men and women need your help. And, in particular, to stress that this shouldn't be about cost. It really, really shouldn't. So I thank you for your time, your consideration, and also all of you for your continued dedication to public service during these extraordinarily difficult times.
Fellows, you have a question? Representative Fellows?
Thank you. Mr. Durkin, can you tell me if there are any other states that put dispatchers in the same category as police and fire for retirement?
Not that I'm aware of in our region, Representative. We are pursuing this. We have quite a lot in Massachusetts. We came very close, actually, the last time around to moving them into what we call Group 2 in Massachusetts, which is not, in Massachusetts, it's Group 4 for police and fire. We got 4 groups. Police and fire are in Group 4. State police are the only ones in Group 3. And then Group 2, which cuts 5 years off the age. And then Group 1 is everybody else. We made tremendous progress in the last session, but again, with the pandemic, a lot of good legislation stalled out across the country. But they are,
thank you.
Thank you, Representative.
Representative Schmidt, do you have a question?
I do, Madam Chair. Thank you very much. Mr. Durkin, if I understood correctly, the prime sponsors ask for this bill to be retained because it has some problems. Is this going to be going forward, Madam Chair?
It's, as far as I know, this month, we'll be able to make progress.
I'm not hearing you well, Madam Chair.
I apologize. My intention would be to retain it and work on it over the summer when we can make more progress in this sort of meeting.
Okay. I recommend you stay on top of this, Mr. Durkin.
Certainly, Representative. Thanks very much.
You're welcome.
Are there any other questions? Seeing none,
Madam Chairman, Representative Trottier has rejoined us, and we've labeled him by his full name, so he's easier to find on the list.
thank you, Representative Troyer. I've already mentioned your request in this bill. Other points you'd like to make to the committee?
Good morning. I cannot hear you on the last comment or question.
I asked whether you wish to speak to the committee, considering we've already heard your request.
No, at this point, basically, I am going to ask that the bill be retained. I feel that a little bit more research needs to be done before we bring the bill forward.
Okay. Thank you very much.
Thank you.
No one else has their hand raised, so I will close the hearing on House Bill 619 and open the hearing on House Bill 274 and call Representative O'Brien, who is the prime sponsor. Representative O'Brien?
I can't hear you, Representative O'Brien.
In that case, Representative Cushing is a co-sponsor. Is he here? I don't see Representative Cushing either.
Madam Chair, can you hear me now?
There you are.
Okay, thank you. Minor adjustments. I apologize. Thank you, Madam Chair, for recognizing me, and good morning to my fellow committee members on ED&A. I'm happy to serve with you. And I'm also a proud sponsor of House Bill 274. Let me cut to the chase because the hour is late. But basically what we're talking about here is trying to get back what was once part of the retirement system. As you all know, they used to contribute 35%. It got weaned down in tiers, go down to basically zero. When that occurs and you don't really fix the whole complete structure, that means somebody's got to make up the 35%. And those people that are making it up have been some of the stakeholders themselves, members of that are currently paying into the retirement system. But also, this came down to each individual city and town so that they would be responsible to pay that 35%. Now, I can speak about the city of Nashua. This has brought up about a $2 million charge to pay into the pension system. Where does that money come from? Well, money, as we all know, money doesn't grow from trees, so it comes from the taxpayers. So one could say by the state alleviating the responsibility of 35% has cost an additional tax to the taxpayers of all communities throughout the state. It is the hope of complying with this bill that we can alleviate that. Let's look what cities and towns and all across our state are going through. I can say that's common. All cities and towns are paying into this, but also I can speak for Manchester and Nashua, the homeless population, the opioid problems, the other different things that come up that kind of eat into the taxable structure. And now, on top of it, you got to pay into the retirement system. So therefore, the intention of this, to sum it all up, is trying to get the state back into realizing that municipalities need the help. With the COVID that's around right now, municipalities need the relief. This is no longer anything that municipalities can absorb. They need the help to get back to some degree, and hopefully within the 15%, that will alleviate some of the municipal burden into the retirement system. And Madam Chair, if I can ask, I would hope you have on your speakers list the people that can really get into the weeds on this much better than I can. Would be His Honor, the Mayor of the City of Nashua, James Donkus, and his CFO, John Griffin. So if you could recognize him at some point when you're ready to speak, I would greatly appreciate it. And I'll conclude my remarks. Thank you.
I look for representative for Mr. Donkus because he signed up to speak. He doesn't appear to be an attendee, so we will wait. Maybe he's not with us.
Are you, if I may, Madam Chair, are you seeing CFO John Griffin?
He didn't sign up to speak.
Okay. May I ask a little grace? This is all kind of new to us. He is the CFO for the City of Nashua, a true cruncher of the numbers. If you can extenuate the courtesy, I would appreciate it.
Representative Bryan, after the people who have signed up have spoken, I will ask for other members, and you can hear from him at that time.
And I graciously thank the chair. Thank you.
I see Nashua Mayor listed in the attendees.
And I will call on him. First, though, we will hear from Mr. Carlin from the retirement system.
Thank you, Madam Chair. For the record, again, my name is Marty Carlin, representing the New Hampshire retirement system. Just as a housekeeping matter, I didn't have any testimony on House Bill 619, but did want to mention that we sent a handout that Pam was circulating last night, maybe of use to the committee if the bill is retained. As to House Bill 274, NHRS has no position on this bill. I signed up more for informational purposes, and we have a handout on this one, NHRS Bill Brief HB 274. If you have that with you, it just provides a little bit of a background history on the state contribution subsidy for local costs of teachers, police, and fire, which was eliminated back in 2012, I believe. And also just a summary of the fiscal note that's attached to the bill, which would show the state cost at a 5% contribution for local employers for those three member groups. This is not an actuarial bill or will have no impact on employer contribution rates for NHRS. This is simply somebody else will be paying a share of the local cost to NHRS, but the total net amount coming in will be the same. I'd be glad to answer any questions anyone may have.
I don't see any questions from the committee. Call Becky Benvenuti.
Yes, thank you again, Madam Chair and members of the committee. For the record, I am Becky Benvenuti, Government Finance Advisor for the New Hampshire Municipal Association, and I am here to speak in support of HB 274. And I have also submitted to the committee written testimony. Restoring the state's share of employer costs for police, teachers, and firefighters has been a long-standing policy of NHMA. While most political subdivisions in New Hampshire also participate in the retirement system for their employees, participation is mandatory under statute for police, fire, and teacher members. The state's contribution, which was originally 40% in 1967 before being reduced to 35% in 77, was also mandatory. The legislation amending the statute in 2011 to eliminate completely the state's 35% share for police, fire, and teacher employer costs has been one of the largest fiscal impacts upon municipalities in decades. In just the 8-year period from 2013 to 2020, the elimination of the state share has amounted to an increase in the employer contributions required to be paid by political subdivisions of over $720 million. The current $6 billion unfunded liability, which was amortized over a 30-year period ending in 2039, is required to be paid through the employer contributions, and the state also had a 35% share in paying this longstanding obligation. The elimination of the state's share of the employer cost has downshifted this state-level financial responsibility to the local taxpayers, whose municipal, county, and local school property tax rates have all increased over the past 8 years to raise the property tax revenue necessary to fund the additional $729 million in municipal, school district, and county employer costs, which are mandatory for police, firefighters, and teachers. Although a 5% contribution, which is estimated to be $17.66 million, would restore significantly less than the state's original 35% share, estimated to be $123.62 million, this bill would provide some immediate and needed relief to political subdivisions and help offset the major rate increase, which becomes effective July 1st. We respectfully ask that you vote in favor of HB 274. And again, thank you for your time.
Thank you. Are there any questions from the committee? Seeing none, Mayor Donches?
Well, thank you, Madam Chair and members of the committee. I see Mike O'Brien, Representative Mike O'Brien, who's also on city government with me. So I'm glad to be before you. We are asking here that the state, as you just heard, return to contributing a small amount towards municipal pensions. Now, the problem here is that the cities and towns across New Hampshire are the victims of a broken promise. The way the state retirement system was formed, the reason that so many municipalities are in the system, and basically all municipalities are part of it, is that the state promised that in order and induced the communities to enter the system by promising that if the communities entered, the state would pay first 40%, as you just heard, would pay 40%. And of course, that was an attractive inducement, and all cities and towns basically joined the state retirement system. That was reduced to 35, but that was, a very modest reduction and probably didn't upset too many people or at the time back in the 70s. Then, as you've already heard, both from the previous speakers, in around 2011, the amount of the contribution was reduced to zero. This has worked an incredible hardship on cities and towns across the state. The result of a big increase in costs always means, I think when you're dealing with local budgets, always means a combination of a tax increase with a reduction of services. So there's no question that we, not only have local taxes been driven up because of this, but also quality of schools, police protection, and other services provided by cities and towns has also been affected. Again, most cities and towns handle a big increase by kind of balancing some tax increase with some reduction in services. Now what has happened is that, you'll hear more about this afternoon, but that the retirements, and so over the years, as a result of decisions made at the state level, not by the local communities, somehow the system got underfunded. And this was a result of probably making decisions to extend benefits the system couldn't afford, to not, maybe the management of assets, maybe the not charging back, some years ago what should have been charged. And so as a result of the decision to reduce the assumed rate of return, which is, that part of it is mandatory, they have to use fiduciary responsibility to make that decision. But as a result of that decision being made, communities are now being hit come July 1, 2021 with another huge increase. For us in Nashua, and I just give you our figures, not because we are different or more important or anything else, but just to give you some, this is the numbers I know. Our increase is $4 million, which is already a 2% tax increase for the taxpayers of Nashua, on top of a reduction of school aid. So this is a very big hit, and this hit comes at exactly the wrong time. I mean, we were struggling with the COVID-19, the increased costs, decreased revenues as a result of that pandemic, the prospect that real estate values in the commercial areas could certainly go down as a result of the pandemic, raising residential property taxes. So this is working a huge hardship. And of course, we have additional costs related to the learning gap that is resulting because kids aren't going to school, things like that. So the 5% bill which you have before you would not completely offset the increase that is being made by as a result of the reduction in the rate of return. It might reduce that impact by about half. So for Nashua, maybe the increase would be 2 million rather than 4. But as I said at the beginning, all of the cities and towns whom you represent are the victims of a broken promise. Again, I'll just give you Nashua's figures. That broken promise has already cost the citizens of Nashua $74 million. Money that could be, we're the new middle school, we could cash almost if we had that money back. So we're asking you to help us with some relief here. Taxpayers and communities across the state really need this. And of course, I am certainly available for questions if anybody has any.
Are there any questions from the committee? Representative Pearson.
Thank you, Madam Chair. Mr. Mayor, I know you have not been mayor for a substantially long time, but do you recall the city of Nashua ever objecting in the 1990s when the bill seemed to go away?
When what?
When the bill from the state, when the state legislature decided to give a moratorium on the bill into the pension system in the 1990s. I mean, this current situation we're in is a combination of faults and errors, if you will. And
well, my answer is, first of all, I wasn't in city government then, but
right.
In a way, why should they? They're relying on the state of New Hampshire to run this system. We're not part of the running. They say that they don't need money. How would anyone question that? So, yeah, that was a huge, huge mistake. And taxpayers at the time, I'm sure benefited from it. But that was 25 years ago. And again, what are we, communities across the state are told us the retirement system doesn't need money by the people who supposedly know what they're doing. We don't have a separate actuarial analysis or anything like that. We don't, what do we know? So, okay, you don't need the money, so why charge us? But so that mistake was I don't think you can blame the communities for a decision like that made at the state level.
Thank you, Mayor Don. Any other questions? Mr. Corrigan?
Thank you, Madam Chair. I hope you can hear me.
Yes.
Great. My name is Dennis Corrigan, and I'm testifying as a member of the public opposed to HB 274. I'm also speaking on behalf of the Granite State taxpayers. I'm a Board of Directors member of GST, and we are the oldest statewide taxpayer group in New Hampshire. I'm a retired pension actuary, and I was appointed by Governor Sununu to be on the Decennial Commission in 2017 as a public expert member when we studied the New Hampshire retirement system and recommended legislative changes. We are here to oppose HB 274, and I've sent some written testimony, but I mistakenly sent it as an attachment, and I'd be glad to resend that as a body of an email if that's more convenient for you. We have two main concerns about this bill. The first is that by shifting part of the cost of funding these municipal pensions to the state, there'll be inevitably a tendency to increase benefits on the part of the plan sponsors, the towns, because in that way they can increase benefits without having to pay the full value of the full cost of these improvements. The second item I'd like to mention is that the increase from a 0% state share to a 5% state share is an enormous step, but the ratchet effect will inevitably mean that moving from 5% to larger percentage shares will it'll be very difficult to resist the calls for that. And I noted Representative O'Brien was already talking in terms of 15%. So I would urge the committee to vote inexpedient to legislate on this bill. And I'd be glad to take any questions. Thank you.
Other questions? I don't see any. Thank you, Mr. Corrigan.
Thank you.
Mr. Griffin?
Yes, Madam Chair, can you hear me?
Yes.
Thank you. Thank you, Madam Chair and members of the committee. My name for the record is John L. Griffin. I'm the Chief Financial Officer for the City of Nashua, and I'm pleased to prepare these remarks for you folks, and we'll follow up with an email. As indicated by Mayor Donchis, we are in difficult times for two reasons. One is the increase in the employer rates for the city pursuant to the reduction in the assumed rate of return. That number as projected in fiscal 22 is a $4.4 million increase. So if the committee and the legislature put in a 5% contribution, that would be 1.2 million off that 4.4. So that's the specifics in that regard. A 15% contribution would be 3.7 million, not quite equal to the increase pursuant to the reduction of the return, assumed rate of return. This is a big item for the city of Nashua. We anticipate spending about 25 million this year in contributions for police, fire, teachers, and employees. Number is going to be 29 million plus in fiscal 22. And as Mayor Donchis indicated, every 2 million increase in costs or decrease in revenue is 1% on the tax rate. So we're struggling at this point in time, given the pandemic, and any relief that we could get would certainly help us weigh those balances that we make every year between the provision of services and the affordability of the tax rate for the taxpayers. So with that, Madam Chair, I'd be happy to answer any questions that you may have. Thank you.
I'm believing I'm hearing you calling on me, Representative McGuire. So, Mr. Griffin, thank you for your testimony. The figures you quoted would be of interest to you, interest to us. Are you planning to, or have you already submitted them in writing?
I will be submitting them, Representative Schmidt. Thank you.
Yeah, thank you very much. That's appreciated.
I'd like to mention to the committee that I just noticed I've got about a dozen pieces of written testimony on these bills in my email. They sent it to the entire committee, so that should be available to all of us. Mr. Corrigan, did you have an additional comment?
Madam Chair, where's the location of your microphone? Because you are extraordinarily hard to hear.
I'm sorry, I couldn't understand you.
I'll try to do it without my accent. The location of your microphone, Carol, it's very difficult to hear you. It's too far away from you.
Okay, is that better?
Much better.
Better.
Thank you for the feedback.
Madam Chair, if I can, just as a matter of feedback, I don't know about anyone else, but I can hear the folks who are testifying remotely much better than any of you who are speaking from the committee room. I don't know if that's something that the tech folks could work on, but just like I said, as a matter of feedback, if everybody else that's listening in remotely agrees with that, I think it's something that hopefully can be remedied.
100% agree.
Thank you. We did.
Madam Chair, I would also like to ask that because the remote people are so much louder, I have to turn the volume down when I'm listening to them. And then to hear people in your room, I have to turn it up again. So if you could, when you ask, if you say, are there any more questions for the speaker? If you could wait 10 seconds or so to give people just a chance to, hear what's going on and to get their hand up, that would be useful too.
Thank you. I will have the tech people come in and balance the volumes. We had to boost the volume of the remote people earlier because we couldn't hear you. So it's a learning experience. Since there don't appear to be any more comments on House Bill 274, I'm going to close the hearing. We resume at 1:15 on the House Bill 130. And we will attempt to get our technical issues solved in the meantime. Thank you all. It is available.
Madam Chairman, I think I see you there, but you're muted, so you can't talk to me, but Scott Kelly's on his way. He should be there in a minute.
I don't want anything too aggressive. My stomach's been upset
That's fine.
this morning. Hasn't helped.
Hey Pam, how do I sound here?
It sounds good. It's certainly not too loud at all, but I could hear most of what was going on. It's just that I think it's sometimes Representative McGuire might have turned your head or, sort of turned away from the mic. But when you spoke right on it, it was loud and clear.
I will have to behave better.
I know it's and you're looking around at the hands in the room or whatever else. It's definitely a learning process.
Okay. So you will share your screen with the out to lunch sign.
That's what I was about to do.
You hear me right here?
I can.
Loud and clear or thanks?
Loud and clear, but you've got a nice strong voice too. So.
Right. Well, I moved the room while the omnidirectional mics right in front of her as well, so she'll have both mics.
Okay.
This
And
mic's still good?
That's good. One thing we need to talk about, Scott, we had our first testimony from an in-person member, a member of another committee came in and testified, and we didn't have a setup for him to testify. So he just sort of stood near the table, and he was the hardest speaker for me to hear.
Okay.
So I don't know what the solution to that is. I'm just throwing it out. Where we are having, you know, he was a chairman of, I think, criminal justice, and they're meeting in another room this morning. So he came in to speak to his bill in ED&A.
Okay, so the committee yesterday put a table out in the middle, and when somebody wanted to speak, they would actually walk to the table and spoke right on the mic. So I do the same thing with public testimony. Oh, commissioners that come in, just have a table set up in the front, like right here. And there's table and mic. Frozen panel. Testing, testing. Hello. Everywhere? Oh, okay.
You know if they broke for lunch or?
Yes. They broke lunch. Hi Pam, can you hear me? I just want to finish our test of the sound.
Oh, sorry, I was doing something else, Scott.
Okay, how can you hear me?
I can hear you. That's where Representative Abbas was standing, more or less right there, maybe a little more toward, towards the center.
Do you have any other people coming in from another committee, you know?
We don't know ahead of time. At least I don't. I didn't expect that. I think the chairman knew about it, but I hadn't heard.
Okay. I'll set up the station anyway, I can be ready here.
That would be perfect. That would be great. I mean, yeah, I don't know. I don't want to mess up the mic system, especially if it doesn't happen again, but it could.
I've got mics, so I'm just gonna that one. Okay, so all the mics sound fine now?
It sounds great where you're standing. I think people need to project some, I don't know if that's part of it.
Right, I moved mics closer to some people, so I think they'll be good to go.
Great. Thank you so much, Scott. Okay, so do you think you're all set with me?
Yes, I am. Thank you, Pam.
Okay, I'm gonna mute myself.
I'm perfectly happy with having the printout prior to, from 30 minutes before. That seems to work.
Yeah, I mean, there was a complaint that somebody had registered and they weren't on the list. It's because he registered late, so.
Yeah, and Don just didn't register as Don, he registers as Nashua mayor, and
Oh.
my eyes just skipped right over that.
Right, and you know, like Representative Trotter came on as Doug T. You know, I didn't know his first name.
This is so reminiscent of all the headline hollering about the vaccinations. You got millions going on. What do you expect? Yes, some are going to thaw out and die. That's too bad. But come on.
Yeah, and I think we've got a decent system and people are learning and it'll get better.
I think this worked fine. This is wonderful.
Yeah, okay.
No,
All right.
The Democrats were here. That's great.
Here are the copies of 130.
Oh, good, thank you.
Pam, have we solved the technical problems from this morning?
I believe so. They were in trying to equalize the volumes. My problem was not
Right.
put right by the microphone is my problem, and we'll do what we can.
Right. Well, if it's as simple as moving the microphone closer to you, that would be great. I mean, you are hard to hear if you're on, if for those of us who are on the Zoom. We can hear each other fine, but we just can't hear you too well. And Terry, we can hear fine, but he doesn't talk very much, so it doesn't make any difference.
Yes, well, it's
You can hear.
like indoor.
I can hear Tony. I can hear Tony Lekas pretty well too. And there are a bunch of the new people that I don't know where they are. I don't see them on the Zoom, but I can hear them every once in a while. But one of the things that's not happening is the speaker is not popping up on the main screen all the time.
That's one of your settings in your Zoom. You have to know where it is and speaker mode.
I'm seeing those. So yeah, I think that's something with your end.
Control of Peter. I can't help.
Okay, well, I didn't know I had an option there. I got my video on. So, but they're not talking much anyway, so it's not a big problem. You're going to start right at 1:15, Carol?
I hope so.
Okay, as far as you're concerned, you're going to start. I'll be ready at 1:15.
That's where the extra few pounds are.
No,
You're behind that.
I didn't realize that thing was there.
I'll move over if you like.
I guess I could, couldn't I?
It's not like there's somebody sitting right
Yeah, no, of course.
Oh, I've got them all.
You got them all ready. This one just arrived.
Is this 1:30?
Yeah.
Okay.
Oh, you figured it out yourself.
I'm very organized. I've got
I
them
am impressed.
all printed out in sequence with my nasty comments.
Already prepared. Okay, well, I didn't, I knew they would be here, so I didn't do that.
It appears that Representative Pearson has developed the need for a shave and possibly a dentist.
I thought maybe he had plastic surgery that hadn't gone so well.
All right. I certainly hope Representative Roy comes back because I'm a co-sponsor and I can't run this meeting. Ah, there he is. Okay, Terry. I'm a co-sponsor.
Madam Chair, I congratulate you on scheduling. This has allowed me enough time to go out and clear my driveway of snow. Much better at noon than at 8 o'clock in the morning.
Yes, I was hoping we would be able, the last bill actually took less time than I expected.
Yeah.
Hard to predict.
Diane will introduce it, and then you should call Marty. I'm not going to be asking questions or doing anything.
Okay, at this time, I'm going to open up the hearing on House Bill 130. And I'm going to recognize Representative Schuett to introduce the bill.
Thank you, Mr. Vice Chair. Well, first of all, I should say I'm Representative Diane Schuett from Merrimack 20, forgetting the formalities of doing these things. And I am here to introduce House Bill 130 relative to administration by the retirement system of certain healthcare premium deductions. I am also at this time presenting a companion amendment, if you will. I introduced this bill at the request of the retirement system to have the legislature determine the question. It's sort of a which came first, the chicken or the egg thing. Apparently there has been a spat between these two agencies for a while as to whose deductions should come first. The bill, as you see it, has the retirement system in the first position, and the amendment, which you should have all received through email, has the Department of Administrative Services in the first position. Mr. Carlin spoke to me about this bill actually 2 years ago, and I attempted to put it as an amendment on a bill last year, but as we all know, last year got sort of bamboozled. So I'm bringing it forward as a clean bill this year, and it's going to be up to the legislature to determine who should prevail. And I believe that there are representatives from both agencies here who can present their respective positions, and then we will go from there. So unless there are any other questions or any other co-sponsors wish to speak, you may proceed with those folks.
Are there any questions from any of the members? Seeing none, the chair will recognize Marty Carlin from the State Retirement.
Thank you, Mr. Chair. For the record, my name is Marty Carlin, representing the New Hampshire Retirement System. I'd like to thank Representative Schuett for introducing the bill and the amendment. Essentially, although we're very close and work very well with DAS, I wouldn't categorize our disagreement as an interpretation as a spat, but I do want to briefly explain what the medical subsidy is and what the issue in question the bill is addressing, or the bill seeks to address. Basically, if you're not familiar with it, we covered it a little bit in the orientation presentation. The medical subsidy isn't an insurance benefit. Rather, it's a premium offset applied if the retiree is paying for insurance from their former employer out of pocket. It works a little bit different for the state because state retirees are insured through the state. So, and the plan was closed for Group 1 members about more than a decade ago for state employees, actually back in 2004. For public safety, Group 2, there are some people who are still active who will qualify for the benefit when they retire, but it is a closed group. So essentially this benefit will eventually no longer exist once the eligible membership population is gone. The question, the subsidies was originally introduced back in the late 80s, early 90s. So the question is, I believe in 2009, the state, the legislature put a premium cost associated for state retirees. And, you know, our long-standing administrative practice was to pay the subsidy amount prior to taking any authorized deduction. There's a phrase in the statute, 10852, it says shall pay the cost. And, you know, we read that as an obligation for NHRS to pay the full subsidy. Our understanding, and I'll leave the details to the folks at DAS. I don't want to speak for them, you know, but there's another piece of the statute that refers to which shall, the phrase which shall be in addition to and notwithstanding any amounts payable to the retirement system, to put the deduction ahead of the subsidy application. So really, we brought this question to our Board of Trustees, and they authorized staff to seek clarifying legislation on the intent of when the state retiree premium is applied before or after the subsidy is applied to the cost. We truly don't have a specific outcome or position on this bill. We're just looking for administrative clarity moving forward.
Any questions from the members? Mr. Conley? Representative Schuett?
Yes, I was just curious, Marty, if the retirement system has in fact searched the section of the RSA that authorizes your position as to legislative intent at the time it was adopted.
I believe our legal folks looked at that and didn't see anything in the record indicative either way.
Thank you.
Any further questions from the members? I'm going to recognize myself for a quick question. Could you explain just briefly what the plus or minus is to the employee on this?
For the state side, it may be invisible. It's going to depend, because typically retiree insurance premiums are higher than the subsidy amount. The subsidy amount was frozen back in 2008. So it's really, you know, if there's a case where the premium is close enough to the subsidy that it would cover the full cost of the benefit, then if they were assessed the state premium, they would be paying some out of pocket for that, you know, if the premium was applied first. You know, for anybody who's on the pre-Medicare health insurance, which is more costly plan, the spread between the actual cost of the benefit and the subsidy is quite wide.
I see Representative Fellows would like to ask a question.
Yes, thank you. I just wanted to ask if someone could resend the amendment, because I don't seem to find it anywhere.
If anyone has that, could send it to her. I appreciate it.
I can look for it in the file and send it to you, Representative Fellows.
Yeah, I don't need it right this second. Thank you.
Sure.
Any further questions of this? If not, Chair, who else wishes to speak on this?
No one else had signed up specifically to speak.
Madam Chair, I think the folks from Admin Services were planning to speak on it last I spoke to them, so they may be in the waiting room.
If anyone from Admin Services is in the waiting room, then raise their hand.
I had made Catherine Keynes aware of this, and she emailed me back that they would be present.
Okay, the chair is going to recognize Charlie Garlinghouse.
Yeah.
Mr. Garlinghouse, can you hear us? It doesn't look like he's muted. See if he's muted.
Would you like me to promote him to a panelist?
That's what's required for him to speak. Yes, please. And it looks like Joyce Pittman will also be wishing to speak. Go ahead, Mr. Armenhouse. I believe you've been promoted.
You should be able to unmute.
Oh, how's that?
Thank you.
Oh, very good. Thank you. The wonders of modern technology. I'm Charlie Arlinghouse. I'm the Commissioner of Administrative Services. And we agree with the intention of the bill, which is to clarify the matter, which I, like Marty, would hesitate to characterize as a spat, as much as a mild disagreement, which we have from time to time. My understanding is that you're likely to refer this to a subcommittee, in which case we would like very much to work on the language. We want to do what we can to preserve the in addition to and notwithstanding language. I want to make a couple of points. One is I want to make it clear that today's discussion is about sources of revenue to the state retiree health benefit. And it is not about local retiree health benefits or any other subdivisions. This is merely about the state plan, that if you're a member or a participant in something else, this is not related to that or related to you. It is merely about the revenue sources to the state retiree health plan. There are a number of revenue sources for the retiree health plan. The largest one is a significant general fund appropriation, but there are a couple of other ones. And we're talking about two of them today. One is the medical subsidy, and the other is the premium contribution. In 2001, the medical subsidy was created. And for those of you who are as old as I am and can remember the 2001 budget debate, you'll remember it was an enormously contentious time because we didn't have much money. Tell me if you've heard that story before. And as part of a bunch of compromises, there was a medical subsidy created, which was about $8 million at that time to the plan. And it is I'm going to make this point, it is a subsidy to the plan as opposed to a subsidy to the individual. This is a transfer. We send money to the retirement system, they send money back, and it is revenue to support the sustainability of benefits for the healthcare plan. In 2009, when premium contributions started being charged, the language, and I believe we actually helped the legislature write the language, and it was probably Linda Hodgson at the time, who people will remember. And to clarify that this was an additional source of revenue, they inserted into the law the phrase, the retiree premium would be in addition to and notwithstanding the medical subsidy. That is to say that I think that's actually fairly clear language, in addition to and notwithstanding. Our position as a department has been that that means that it should be in addition to and notwithstanding. And that's the source of our disagreement with the retirement system, where they think it should not be in addition to and notwithstanding. And we would like that language to be interpreted the way it's written, in the English language. In many past years, this has not been a particular issue, but we're in a position right now, some of you will know, that there are people who are, rather than having their benefit deducted from their retirement check, are being billed for it instead. And it's under 1,000 people, but there's potential for it to grow. And we agree with Marty that we should approach the legislature and come up with that. We did ask the Attorney General's office, Kristen Lavers, who's an Assistant Attorney General, to look at this issue a couple of years ago and to do a thorough review. And we think the legislative history is actually there and is fairly fulsome and reaches a fairly definitive conclusion. I would suggest if you have a subcommittee look at this, that you should invite them to testify as well, and we would be happy to work with you on language. But this is a matter of ensuring that the state retiree health plan has sufficient revenues to support the current benefit level, which I think is a very appropriate benefit level and is actually a very fulsome plan for its members.
Questions of Mr. Arlinghouse? Seeing none. Is there anyone else wishing to speak on this?
Mr. Chairman, it's very difficult to hear you, Terry.
Can you hear me now?
It's much better.
Okay. Is there anyone else wishing to speak on this bill? Seeing none, I will close the hearing on HB 130.
All right. Thank you, and I will now open the hearing on House Bill 150 and call Representative Schuett, prime sponsor.
Thank you, Madam Chair. Many of the members of this committee will recognize, again, Diane Schuett, Merrimack 20. Many of the members of this committee will recognize this bill. It was introduced last year by one of our long-term colleagues, the Honorable Mark Prue. Mark moved out of his old district during the interim and apparently was not in his new district long enough to run for the House again. So I, for one, hope that at the next election round, we'll see him back joining us from his new location. Anyway, the bill that he introduced last year, House Bill 1377, which was introduced to make a technical correction to a law enacted in 2019 and was requested by the Fish and Game Department to make the clarification. That language is exactly what I had drafted into this bill, House Bill 150. That bill, 1377, was adopted by this committee unanimously, passed the House on consent calendar, but then got lost in the shuffle due to the pandemic. Since Representative Prue was unable to present it this term, I'm hoping, I tried to reach out to invite him to attend today, hoping that he might be willing to testify and explain his reasons for putting the original bill in.
Thank you, Representative Schuett. No one else has asked to speak on this bill. So if any person does wish to testify, please raise your hand and I will recognize you. Representative Pearson.
Thank you, Madam Chairman. This is another bill that OLS screwed up the people on, but that's here nor there. So for those that are new to the committee, we looked at this last session, and one of the reasons for this really had to do with a technical mistake or omission, if you will, in the sense that it was including folks, police officers, firefighters, rescue squad folks in a certain area, and then not necessarily in the other area. The other issue with this is if you look down at Part 2, subparagraph H, the original language put a restriction into the activities of a rescue squad member that required them to be involved in a fish and game activity to recover a lost person. The reason why this legislation takes out to recover a lost person is because that was so narrowly defined, that it just it made the intent of the legislation have to meet just such a bizarre requirement. And that was the big thing that Representative Prue was trying to fix. So, this isn't inventing something new. It's really just a housekeeping measure. And if you look at the language in Part C, and again, the removal of 2H, that part at the bottom about having to recover a lost person, it really does put this back in line with what the original intent of the legislation was.
Fair to say that the language currently requires them to have for a lost person rather than for an injured person whose location is known.
That was correct, Madam Chairperson. That was very much discussed in length at the, 2 years ago or a year and a half ago, whenever, when we had discussed this, and it was not a big deal then. When Representative Prue had brought this forward, it was really just a technical correction. So, that's what I remember about his testimony, and just looking through the bill itself, that's really all it is. It's not. There's really nothing more to it than that. So,
Thank you. Are there any other people who wish to testify? I don't see any hands. All right then. Thank you very much. I will close the hearing on House Bill 150.
And it looks like we have some time before the next hearing.
Yes, and I will open an executive session.
Oh.
Would someone have a motion on either House Bill 150 or House Bill 619?
I'd make one on 150.
Okay,
Ought to pass.
Second.
Okay.
so Representative Lekes has moved ought to pass. Representative Roy has seconded. Is there any discussion? Representative Schultz?
A short caucus with my fellow Democrats.
I'm sorry, would you speak louder?
Could I request a short Democratic caucus for our committee?
You may. I don't know how you will arrange it.
I just know that I had a few questions on one bill in particular that I wanted to talk to my fellow Democrats about. And while I don't necessarily mind a quick exec session, I really don't.
Okay.
Ready.
The only two bills I think we are clearly ready to exec are this one, House Bill 150, and House Bill 619, where the sponsor asked us to retain it.
Would you mind giving me 5 minutes to call my ranking member then? Can you hear me?
Yes, I heard you. I'm just, yes, we will, we'll take a short break and casually discuss these bills while we'll give you 5 minutes.
Thank you, Madam Chair.
So I did manage to introduce the bill and the other one. I think they may have been afraid I was joining criminal
Hi,
justice.
Jeff, I'm interrupting Chris.
Representative Schuett, mute yourself.
They were running late, and then their whole system collapsed.
We just have the usual problem with the moment.
Ah,
There you go.
she's not bribing me for my vote.
Well, I
He's
don't
not
know.
that cheap.
No.
We don't need to.
That didn't look good.
I would just remind everybody in the room that the sound is on. The system is not muted for the committee room. And nobody has said anything, but I just wanted to say that before. anybody does.
We're very transparent about our Fridays.
Pam,
Yes.
Pam,
Yes.
is Peter. So I know it's possible to have caucuses through Zoom because we did it in Stratford County back when we had our organizing meeting, but you have to have a technician who knows how to do it. And I don't know whether that would mean you.
I know it would not mean me. Yeah. We're not at all involved in caucuses.
Well, but somebody has to be the technician that sets up the caucus. I'm not sure how that would be done. Whether somebody's going to reach out to me or whatever. But anyway, so you're not involved in that.
No, I'm never involved in caucuses.
Right, but somebody has to be the host that sets it up. And you are that person. So anyway, I'll just wait to be contacted. Yes. And how much time did Carol give us?
There was a request for 5 minutes.
5 minutes. Okay, good. I'll just wait to be called. Thank you.
Pam, this is Representative Roy. Could you promote me to co-host?
Is somebody going to do that? I wasn't.
I'm sorry. I could hear somebody asked to be promoted to co-host, but I couldn't hear who it was.
That was Representative Roy.
Oh, I'm sorry. Okay. Absolutely. We lost internet is what happened at noontime. It just happened that you were at lunch, so you missed the excitement, but that's why people may have lost their status, and we're happy to be back on, on track.
Sorry, Madam Chair, I'm finished with that quick conversation. I apologize. I wasn't trying to be difficult, and I hope I didn't create a difficulty. I just wanted to make sure I really understood what was happening, and I do now.
No problem. This is our first meeting, so we haven't worked a lot of things out. I will say that we are on a relatively tight schedule. We're going to have to work execs in, so I would recommend you caucus as you see fit. The Republicans had a caucus last Thursday.
And Madam Chair, I've always appreciated how efficiently and swiftly you run the committee, so I appreciate that reminder. Thank you.
I approve of thinking. All right. So resuming our executive session, we have a motion by Representative Lekes to pass House Bill 150. Is there any further discussion?
I'll just say that, as was said, the first part of it is a technical correction. In the first part, it includes emergency medical technician, rescue squad members. And in the second part, which seems to deal with the same thing, just a little variation, they left it out for some reason. And in the second one, it's if people are part of a search and rescue effort, then, that should cover it. And adding to recover a lost person seems pointless anyway. So I see it as a technical correction we should just approve.
Yes, Representative Roy.
I don't see a fiscal note on this, but it clearly would have a fiscal impact.
Maybe, maybe not.
If I could,
Please.
I think on the second part, I don't think that there's probably anybody that's, part of search and rescue and then they decide wasn't involved in recover a lost person. I don't know that there'd be any there. And the first part, I don't know how they've been handling it, but I think it would be pretty minimal, if any, fiscal impact, but that's just my guess, basically.
Yes, there aren't that many death benefits issued, and I would, at any time, and I would suspect that in this case, there would be very few people.
And the only difference would be for someone, an EMT or rescue squad member who died and had no surviving dependent child. Can happen, but it really cuts it down, I think.
Madam Chair, I'll point out there was no fiscal note on the original Bill 1377 either. So I think it's been determined in both session years that there is no major fiscal impact to be considered.
Excellent, thank you.
Oh, thank God. Thank you, sweetie pie. I only have 2 bills left.
You're unmuted, Jackie.
Yes, there are 2 bills left, that's correct. Any other discussion on House Bill 150? All right, seeing none, the clerk will call the roll.
Representative Roy,
Yes.
the clerk votes yes. Representative Pearson,
Yes.
Representative Yakubovich,
Yes.
Representative Lekis,
Yes.
Representative Allegro,
Yes.
Representative Bailey. Representative Bailey.
Yes.
Yes, okay. Didn't hear you the first time.
I had trouble with my mute.
Representative Lanzara,
Yes.
Representative Santonastaso,
Yes.
Representative Goley,
Yes.
Representative Schuett,
Definitely.
Representative Judy,
Oui.
Representative Schmidt,
Yes.
Representative Schultz,
Yes.
Representative Fellows,
Yes.
Representative Fontenot,
Yes.
Representative Grote,
Yes, please.
Representative O'Brien,
Yes.
and the chair,
Yes,
19-0. Because we're all here.
all right,
Excellent. Our first piece of
thank you,
legislation.
excellent.
Consent calendar?
Does anyone object to consent? Good, we'll put it on consent.
Thank you all.
Okay. One point. I have been instructed that we are not to allow votes by people who call in without video. It's not going to matter in this case, but Representative Judy does not appear to have video. I believe Representative Fontenot has video. What was it?
You all know his voice.
Well, yes, I'm not worried about it, and in this bill, it certainly isn't going to matter whether it's 18-0 or 17-0. But in some cases, it may make a difference, and I would hope that Representative Judy managed to get some video.
I would point out, Madam Chair, that Representative Judy's voice is probably the most identifiable of all our committee members. So there's no doubt that's who it is.
I agree.
Correct. But we don't know if there's somebody standing behind him with a gun on his head. As in one of the cases.
Madam Chair, excuse me. Madam Chair, I am alone in the house. My wife, she's hospitalized. I am alone in the house.
I understand, I agree. It's just that I think I wanted to point this rule out, and I hope we can manage to get you some video.
Madam Chair,
Yes, Representative Golding.
I just want to pass along, Representative Prue says thank you to the committee for the vote on this bill.
Yes, we appreciate it.
Madam Chair, may I ask a question?
Yes.
So what's the decision? Is it going to be 18-0 or 17-0?
It should be 17. I will discuss this issue with the speaker, but for now, Representative Judy vote doesn't count.
Okay, so you want me to change?
Just, yes.
And Fontenot?
That- I think everybody else
Somebody had what looked like just a static
is.
image.
That was Jackie Rhoda.
Everyone else seems to have video
I'm right here. You can't see me?
on and off there.
No,
Would that not make the vote 18 to nothing? I thought it was 19 to nothing, counting him.
I thought it was 19 to nothing as well. We can see you, Jackie.
Thank you. While everyone's counting, please accept my apology. When I screamed, thank God, it was because my husband brought me a cup of coffee. And I didn't realize I was unmuted. I'd been up in my office since 9 o'clock. Apologies, please.
So, Madam Chair, if you're going to get a clarification about what to do when the person isn't using Zoom, is only using the telephone, could you just clarify also if video means you have to see our face or we're just using Zoom? Because that's two different things.
I think it means you need to use your face. And in fact, I haven't seen Representative Santanastasso's face today. So if you care to.
Oh, we saw him before. We saw him before when he was in his car.
Okay, yes.
Oh, that's right, yeah.
All right.
I'm sorry, Madam Chair, I guess I'm gonna be that. We can't see you at all, just for whatever it's worth. Obviously you're in the LOB, but for what it's worth, I can't see anyone who's actually in the LOB EDNA room or whatever, just for the record.
Well, actually, we're down on the second floor. It's not our own room. But there are, in fact, 4 other members of the committee who are here, and we can all see each other.
Great. We can see you. You're visible. I can see.
Yes, that's correct. You are visible. You're very tiny, but.
Representative Schultz, they're in the long shot, technically speaking.
Yes, that's correct.
Forward,
The main screen, we should call it.
forward, that we proceed according to the rules. And if the person cannot be seen live, it's bad enough that we're doing this in the fashion we're forced to. But if a person cannot be seen live.
Yeah, I agree. And again, today I expect the vote on the next bill to be unanimous also. So I'm not going to worry about it, but I will get clarification before our next meeting.
Madam Chair, this is Representative Groda, if I may. I would recommend that when taking the vote, everyone who is calling from remote does have their face visible so that we can at least see everyone voting in person. And those people on the phone, I do agree that the rules are those people calling in on the phone that are not visible are not allowed to vote. That was what I read in the information sent to us.
Yes, that was I had. And I will get a clarification and I will see what we can do about Representative Judy.
Yeah, I'd like to point out that handhold Representative.
Madam Chair, this is Representative Jean Judy. In that note, I see number 1 to join with the banner HSTPS and all telephone dial for higher quality. So I don't know why they put all telephone.
I'm sorry, Jean, I didn't understand you. Would you repeat that?
No, I see in my calendar, we put number 1 to join the webinar, HTTPS, and second, or telephone.
Right. But we shouldn't be using the calendar Zoom link. We should be using the link that is sent to us individually. The calendar link is for the public to participate in the meeting. Of course, they don't have a vote anyway. But it's been correctly stated that the rule is quite clear, if you're on the Zoom, you can vote. If you're just calling in by telephone, you can't vote. So maybe some additional clarification is possible, but that seems fairly straightforward, and we just have to get you some technical improvements so that you can be on the Zoom with the rest of us. But you shouldn't be using the link that's in the calendar.
Representative Schmidt is exactly correct. You have been, each of us has been sent twice, in fact, a link to the meeting that is unique to ourselves. The calendar is for members of the public. All right, so. Yes, sir.
Does he, Representative Judy, do you have a camera?
Yes, I have.
Okay, all right.
On your phone.
Yes, I have.
Okay, we'll have to send somebody to help you figure out how to log in with video.
All right, thank you.
So we have 5 minutes. Does someone have a motion on House Bill 619?
Representative Groda makes a motion to retain the bill.
Representative Roy was voting it, so therefore he is counted as second. Yes, I can. Okay, so it's Groda and Roy. Is there any discussion?
I just think that the prime sponsor requested to be retained. While it needs to work, we should do that request and give us some time to work on it.
I can't hear what that comment was.
Comment was that the prime sponsor thought the bill needed some research and has asked us to retain it.
Oh.
To do so.
Right.
Any other questions?
I mean, it's our bill now. We have control over it. We don't have to abide by the prime sponsor's wishes, but to the degree that the bill is defective or has issues, I think we should oblige him and proceed on that basis. I'll support the retained motion.
Representative Goley?
Thank you, Madam Chair. Well, I am not in support of the bill as written. I will give the sponsor time to come back to us as he has requested, and I will support the retain.
Thank you. Any other comments? In that case, clerk will call the roll. The motion is to retain.
To retain. Representative Roy.
Yes.
Clerk votes yes. Representative Pearson.
Yes.
Representative Yakubovich.
Yes.
Representative Lekis.
Yes.
Representative Allegro.
Yes.
Representative Bailey.
Yes.
Representative Lanzara.
Yes.
Representative Santo Nastasso.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Nice day, isn't it, Representative Judy? Representative Schmidt.
Oui.
I believe I was called, so I'm voting yes.
Representative Schultz.
Yes.
Representative Fellows.
Yes.
Representative Fontno.
Yes.
Representative Groda.
Yes.
Representative O'Brien.
Yes.
And the chair.
Yes.
18, 1 phantom to nothing.
All right. Thank you. That's
2 down, 85 to go.
only 51 to go. All right. Thank you all. and close the executive session and open the hearing on House Bill 173 and call Representative Schuett to speak.
Thank you, Madam Chair. Again, it's Diane Schuett, Merrimack 20, here to bother you again. Introducing House Bill 173, which requires the Independent Investment Committee of the retirement system to report investment fees. This bill is an attempt to add some transparency to the actions of the Independent Investment Committee of the retirement system. Like me, I'm sure many of you have some investments that you have on the outside, and it's pretty de rigueur that you get at least quarterly statements from those investment companies or from your financial advisor telling you what they've invested in and what the fees that they've charged to administer those investments are. We as employees, and I'm a retired state employee, I'll state that out there, and as employers, which the state budget pays for state employees' portion of retirement, I feel we should have the right to know exactly how the fees that are being paid, how much the fees are, to what kinds of investment counselors or advisors are being used. Right now, all that we get is the lump sum figure, this much has been spent, and then we get the returns. And quite a few of us were quite alarmed at the returns at the end of the fiscal year in June of 2020, when they came back with a return of 1.1%. It seemed quite low and basically abnormal compared to many other and many other funds that are out there. So this is just an attempt, as I said, to try and have these figures be made public. I understand that Mr. Carlin has said that they can be posted on the retirement website. The cost should not be anything major. I honestly believe that these figures are probably reported to the investment committee, and it's just a matter of relinquishing them to the membership and the employers.
Thank you. Are there questions? Seeing none. Yes.
I'd like to point out a couple of things. First, there is no connection between the fees that we pay and the return that we get. I'm not opposed to the bill, but I don't see how, knowing that the ABC manager voted this way or that way, how that actually will affect us. The other thing is, yes, we may be under this time, but nobody ever says anything when it hits 14%. So it's we can't be Monday morning quarterbacks. I'm voting for the bill.
Thank you.
I am, if taking that as perhaps a question, I will say that I think if the fees that are paid to, as I said, specific consultants or firms would give a better judge of the value of the judgments that are being made. And I think if the judgment of one or more members or the entire investment committee are in question, that's probably the only way that we could tell.
Thank you. Representative Fellows, you had a question?
Yes, thank you, Madam Chair. Representative Schuett, do you know if other state employee retirement funds have a report like that that they make available?
Yes, I understand that there are many. I don't have the exact number. I'm guessing probably Mr. Carlin could tell us.
He's the next speaker. See, no other questions? All right, thank you, Representative Schuett.
Thank you.
Recognize Marty Carlin from the retirement system.
Thank you, Madam Chair. Again, for the record, my name is Marty Carlin, representing NHRS. This bill was put in last year and made it through the House and died in another omnibus bill over the summer. At that time, just like now, we have no position on the bill and believe we would be able to produce a quarterly report, without any additional significant expense. Just to address a couple of the comments made earlier, just by way of background, I did want to say that, National Council on Public Employee Retirement Systems, NCPERS, does a survey of participants on investment fees, and our fees were lower than the national average by a fairly significant margin in the last survey as a percentage of assets. It was 30 basis points or 0.3% of assets, and the national average was 48 basis points. Additionally, we do with new manager agreements, we have what we refer to as a most favored nation clause in investment agreements, which says that if another comparable public plan invests at the fund with a lower fee structure and that we currently have, our fees will be adjusted downward. So I just wanted to reassure that the committee, this committee, ED&A, that the investment committee does all it can do to try to manage fees and keep them at a reasonable level. In terms of transparency, just if you're not aware, the investment committee does meet monthly, and those meetings are open to the public. They seldom, if ever, go into non-public session. So folks can observe if they would like. And since last year, another member has been added to the investment committee by statute, an existing public employee member, a Portsmouth fire captain. So there's someone from the membership who's involved in the committee and following all this. With that, again, we have no position or concern with the bill, so I'll yield the floor and welcome any questions if you have any.
Thank you. Are there questions? Representative Schuett.
Thank you, Madam Chair. Mr. Carlin, is it not true that the employee member was put in as a non-voting member?
That's correct. The legislation added the member as a non-voting member, although he still is a full contributor and asks questions and sees all the same material. With that addition, it's a 6-member committee. There's 5 voting members and the public employee.
Thank you.
Representative Fellows.
Yes, thank you, Madam Chair. Can you just answer the question that I asked Representative Schuett about? Do other states produce a similar report for their retirement systems?
What you're going to see nationally is probably a hodgepodge. I'm sure some do, and some may not. That's one thing with investment fees that actually the GASB, Governmental Accounting Standards Board, is looking at in terms of establishing national standards on fee reporting. They kicked off a GASB project on that last year, and they're looking into sort of standardizing that. And to get a clean audit opinion, you need to follow the GASB standards. So whatever they come out with, if it's not what we're already doing, we would adjust accordingly. But, it varies quite a bit from state to state. I can't point to any state that has a gold standard, report type of thing, but different levels of disclosure there, around the country.
So that after this bill is implemented, New Hampshire will be the gold standard?
Depends on who's weighing the gold.
All right. Any other questions? All right. Richard Gullah.
Can everyone hear me?
Yes.
Great. Thank you for having me today. My name is Richard Gullah. I am president of the State Employees Association, SEIU Local 1984. Represent nearly 10,000 employees here at the state of New Hampshire, county, municipal. I'll be brief. House Bill 173 is asking for not only the disclosure of the amounts of the investment fees, but is also a transcription of the fees. This brings further transparency and accountability to the investment process. This will help provide an opportunity for the members, both active and retired of the system, as well as the public at large, to ensure that the fees being paid to invest a $9 billion public employee retirement plan are being spent wisely. Like many other factors, investment fees are an important piece of keeping the retirement solvent and stable. We are concerned with seeing only a 1.1% return for fiscal year 2020, where many other states outperform New Hampshire significantly. And House Bill 173 will allow for transparency and accountability in the investment process to ensure that the funds used to provide benefits are being protected and also being done in a prudent manner to provide stable and predictable rates for our employees and retirees. And with that, I will conclude my testimony and thank you.
Okay, seeing none. Is there anyone else who wishes to apply on House Bill?
Having trouble hearing you again.
Yes, I moved my, sorry. Does anyone else wish to testify on House Bill 173? If so,
Madam Chair, this is not an issue of your microphone. The members need to mute. Everybody's got to be on mute, otherwise we're not going to hear the primary microphone.
I'm sorry, Representative Pearson, I didn't hear you. Sorry, my microphone wasn't turned on. That was operator. I repeat, is there anyone else who wishes to speak on House Bill 173? Seeing none, I'm going to close the hearing. And since we have a few minutes, go into executive session on House Bill 173. And I recognize Representative Roy for a motion. Is there a second?
Second.
I'll second.
I couldn't hear that.
Okay, Representative Goley seconds. Is there any, would you care to speak on your motion?
I think we pretty much covered it. There's no offense to the state, greater transparency for everybody, so it sounds like a winner all around.
Representative Goley?
I was having a hard time hearing Representative Roy, Madam Chair.
So was I. I couldn't actually hear the motion that he made.
Oh.
It was a motion.
Second, that.
The microphone fell on the floor.
Yes, sorry, we're having trouble. Yes, Representative Roy is speaking with a polite inside voice, and it's not transmitting very well.
Yeah.
This microphone's on the desk.
No, on the floor.
Okay.
Okay, hello. Yes.
That's better.
Yeah.
Madam Chair, I got to leave the meeting. I'm out.
Okay,
See you, Steve.
in any event, the motion is ought to pass by Representative Roy, seconded by Representative Goley, followed by technical issues. Is there any discussion of the motion? Representative Saitek.
This is getting, I'll vote for this, of course, but it's getting into the weeds. I don't know how many managers there are, how they bill, how they're tied to specific funds. I don't know how this really does. It's great, but I don't see how it's going to accomplish anything unless you are really into this whole, I'll call it the weeds of the details of how this is all done. It's all a mystery to me, so I'll leave it at that.
Is there anyone else? All right, seeing none, the motion is ought to pass, and the clerk will call the roll.
Representative Roy.
Yes.
The clerk votes yes. Representative Pearson.
He has left the meeting.
What happened to him? He left. He is not voting. Representative Yakubovich,
Yes.
Representative Atkins.
Yes.
Representative,
Yes.
Representative Bailey,
Yes.
Representative Lanzaro,
Yes.
Representative Santonastaso,
Yes.
Representative Goley,
Yes.
Representative Schilling,
Yes.
Representative Judy is here. Representative Schmidt,
Yes.
Representative Schultz,
Yes.
Representative Fellows,
Yes.
Representative Bugno,
Yes.
Representative Groden,
Yes.
Representative O'Brien,
Yes.
and Representative McGuire, the chair.
Yes.
Looks like it's going to be 17 to nothing.
Does anyone object to consent? Okay, seeing none, we'll put that one on consent.
Can I just hear what the count was?
17-0. Since Representative Schmidt left the meeting.
Representative Pearson left the meeting.
Pearson, excuse me. I usually tell them apart. All right. We have 12 minutes before the next bill. Does anyone think there is another bill that we could exec in that period of time? Okay.
Possibly 1:30. Possibly 1:30.
Possibly, but I think the 130 has a problem that there's an amendment, it's
Oh.
also not a, not agreement on that.
Well, not even.
All right, Representative Roy suggests that we address House Bill 91. If we complete it, if not, we will adjourn, recess the executive session until later. So what is Representative Roy?
I move 91 off the pass.
Repeat that, please.
House Bill 91
No, I mean his motion.
ought to pass.
Schmidt seconds.
Representative Schmidt, second. Do you wish to speak to your motion?
If I could have a microphone. Thank you. I had moved off the pass on this. I believe that this legislation is keeping in line with the sentiment and the idea of line of duty deaths. I believe that there was ample testimony that, given the new awareness of PTSD and the effect on emergency workers, that this should definitely be considered a line of duty death and it should be covered. And like I said, I think you all heard the testimony. I felt it was rather compelling. So as I said, I move off the pass.
Representative Schmidt, you used to say something?
I do, Madam Chair. Let me just get myself up. So I think we heard the same test last time and approved the bill. One thing that was new this time was the statement that research shows that that such a provision does not, in fact, lead to suicide ideation. And we recognize, of course, there are not too many people who are going to kill themselves for others' benefit, but the benefit is for the family and the survivors. And I fully support the idea that we need to do something about this, and for our first responders who are under tremendous stress in their chosen profession. So I'll happily vote for the bill as well.
Thank you.
Madam Chair, someone
Yes.
second it?
Yes, Representative Smith did.
Okay, sorry, I missed it.
Is there any other, Representative Allegro?
Yes, I'm concerned that this bill changes the meaning of the words in the line of duty. And notwithstanding the testimony that we heard that suggested that $100,000 is not an inducement, $100,000 is a chunk of change. And as I heard it said to me recently, by way of example, you have a police officer who is stressed on the job, stressed financially, stressed for personal reasons, and he's looking at the possibility of gaining $100,000 for his family. I'm concerned that it brings into effect the George Bailey path, which is I'm worth more dead than alive to my family. Also, again, notwithstanding the testimony that we heard, which I do not believe is supported by any evidence, the bill is a reward for and an inducement to commit suicide. It's a step towards the acceptance and normalization of suicide, rather than the support of those who are considering suicide. So I cannot bring myself to support this legislation.
Representative Seitek.
I don't have all that much history, but when there's been an unfortunate event with a state employee not covered, there have been, I don't think I'm wrong on this, specific bills brought in to help the widow, help the family. And I think that would probably happen in such a circumstance. And I would prefer to see it as policy rather than somebody coming to the legislature for an unfortunate event. This is a tough one. I don't think we're going to, I guess your principle is right, but it's just not going to be a lot of this. So I'll vote for it.
Representative Goley.
Thank you, Madam Chair. This bill passed committee 18-1 last year. And I'm going to support this. And coming from a personal experience, I retired, most of you know, in November. My last day working with Manchester Fire, I spent at a funeral for a co-worker who had committed suicide, who worked with Manchester Fire. I wish we would have passed it last year, so his family elected on this benefit. Unfortunately, we're a year too late for them, but I don't want to see it happen to anyone else. So I will support this.
Representative Fellows.
Thank you, Madam Chair. My concern is not with the concept that I'm fine with that. I'm just concerned with that sentence that was a committee addition to this bill last time around, the one that says death by suicide should be considered a work-related cause of death. And it just seems to me that in many cases it is, but it might not always be. It could be that the person, just had some, personal issues or home issues, somebody who just was served divorce papers or something like that, so that the cause could be something that's not work related. And my recollection, which is fuzzy, is that last year there was somebody testified that wouldn't be, that would not cause this benefit to be delivered if it was clearly not a work-related event that caused the suicide, but I'm not, nobody testified to that this time, and so that leaves me up in the air. You know, I like the concept. I'm just concerned about the wording in that particular sentence.
Thank you. Representative O'Brien?
Thank you, Madam Chair. I would just like to say that I am going to support this. And I want you all, if I may share with you, I think we're just really scratching the tip of the iceberg on this. This has been a long time to come to address this particular issue. You got to keep in mind, like you say, something that may not be related to the job, but everything is cumulative. There are events. You paid me as a firefighter. I held the rank of deputy chief for the city of Nashua for 15 years. I've worked many, many times, suggested many, many times to some of my co-workers that they go into EAP. You don't know what they deal with. You may say, oh, something's going wrong with the marriage, but many times I have seen some of the problems within the marriage has been dragged home from the firehouse. It is an occupation where you pay us to man that wall, and we do it so you can sit home in your armchairs. And the key is this: we see things that you should not see. It's terrible enough that we see them. And for a culture of the fire department, and I'm sure with the police, there's been many, many years where the answer was going out with your buddies and the answer's in the bottom of the bottle. Thank God that has changed. And now with the highlight and with progressive legislation such as this is going to go a long way. Again, it's scratching the tip of the iceberg, but it is a reality. Every firefighter knows another firefighter who has committed suicide. Many firefighter knows another firefighter that has said, what if I reached out another 2 feet? Could I grab that kid? I'm not trying to be melodramatic, but every firefighter does know. What do you think? The victims of a car accident, when they hit a tree, they remain quiet. They're not screaming. They're not calling for mama and trying to get you out of while you're trying to extricate them. These are horrific things. And it, again, you got to keep in mind, it's cumulative, it adds up. And so therefore, something like this will happen. But this is not the panacea. We got to try to stop it on the other end from occurring. But recognizing when a suicide does occur, we are sympathetic to come up with the benefits. Thank you.
Thank you. Representative Schultz, you have 2 minutes, and then we will adjourn the executive session.
Thank you, Madam Chair. I'm tempted to talk about how offended I am by a previous colleague's remarks, but I'll just express gratitude to those of you who have seemed to get that the brain is an organ in the body and that the stigma around mental illness must stop, especially when we have plenty of research that the folks who are put in extremely stressful and traumatic jobs serving for us, that they would have repercussions from that in their brain, in their body, is not a shock. We have plenty of research to show that. And I just want to say, I'm very proud that the majority of us seem to get that it's time to end the stigma around mental illness.
Thank you. Thank you, Representative Schultz, and thank you for being brief. I'm always up in seconds.
I just wanted to address Representative Fellows' question real quick. If you look at line F on the bill, it talks about, because you were concerned about what's considered a duty causing death. It specifically says his or her duties as a result of an incident, accident, or violence causing death or injuries which are direct or proximate cause of death. So in order to award the benefits, there'd have to be some kind of tie back to the job. So as far as, someone committing suicide that has nothing to do with their job, there would be an investigation before it was reported.
Okay, thank you. We're obviously not ready to vote, so I will adjourn the executive session to be resumed at a later point and open the public hearing on House Bill 390. Representative O'Brien, you're the prime sponsor. Would you care to introduce it?
Thank you, Madam Chair. Good to see everybody back on the committee, and I would like to introduce House Bill 390. This is another attempt of mine, and with encouragement from my municipality, but this is not really just to help the Nashua taxpayers. It is the hope that we can help all of the taxpayers in the state to step back and remember the conversations that we shared on House Bill 274. We have stated that there was a problem when the state went from the 35% contributions down to nothing. Well, what had happened in the meantime since that, the New Hampshire State Retirement System came up and wanted to get rid of all the unfunded liability. Now, they came up, and if you remember somewhat, and Mr. Collin will probably correct me if I'm wrong, but I did maybe get the impression that they came up with something like 30 years. They could have probably came up with 50 years. But what I do know in people that probably go out at home and they go out and they get like a 15-year mortgage on their house, and then to come find out that some personal tragedies or some other more pressing financial obligations do come up, people sometimes do go up and they renegotiate the loans. Now, you can say that's kicking the can down the road. Maybe this is kicking the can down the road. But what the problem is, the current state of payment that municipalities have to pay right now is hurting them. Right now, we have COVID. COVID's not going away probably for the next couple of years. A lot of money has been invested into the individual communities. Communities in the example such as Nashua has gone out of its way to try to help our businesses, similar to Manchester. And I think Manchester got the idea from us, but I'll just be proud of my municipality. But the thing is of having outside dining. Well, Nashua has lost some of the parking revenue from some of that. But all these little chinks in the armor is coming up and trying to get to the take care of the unfunded liability. Now, if you remember in part of the presentation that the New Hampshire Retirement System did give us, there is no guarantee in 2039 that all unfunded liabilities will be paid for. So it is the hope of considering this, that municipalities may be able to make the choice to whether to pay this upfront, let's say, like payment, or maybe to ask to renegotiate, to which this bill would be doing, and coming up extenuating it an additional 4 years to 5 years, excuse me, to 2044. Now, yes, will it be expensive? Municipalities will probably pay more in the interest in doing this, but will it get them out of the immediate trouble right now? And it's something to consider. Between this bill, 390, and if I may briefly, Madam Chair, with indulgence, to mention 274 again, one of these got to go through to help out our cities and towns deal with the pension costs. Like the Nashua mayor has stated, all you need is $2 million to raise the tax rate 1%. And that has already happened in Manchester. It has happened in Nashua, and it's happened in each and every single one of your communities. If you have teachers, firefighters, and police officers that are in the NHRS pension system. So, Madam Chair, I'm not going to get too deep into the weeds again. We do have the mayor of the city of Nashua, I hope, is on, that could come up and speak. And through your indulgence at the end, because he did not sign up, but also wanting to speak will be John Griffin, CFO of the city of Nashua. So, Madam Chair, I can conclude my opening remarks.
Thank you. Are there questions from the committee? Thank you very much.
Thank you, Madam Chair.
Marty Carlin.
Thank you, Madam Chair. Executive Director George Lagos will be joining me. We're going to co-testify if possible. He also signed up to testify, and you can, while you're letting him in, I can get started. We did provide a handout on HB 390 through Pam to the committee. I'm not going to read the entire handout, but I do have some comments to make before turning it over to George, and then both of us would be glad to collaborate to answer any questions you may have about any of our testimony. As stated, House Bill 390 would extend the amortization period of the unfunded liability as of June 30th of 2017, which is about $5 billion of the $6 billion total liability, from its current 30-year period ending in 2039 for another 5 years through 2044. At its January 12th, 2021 meeting, our Board of Trustees voted 11-0 to oppose the bill as counter to the board's fiduciary duty of prudence and requirement to adhere to sound actuarial practice. The opposition is similar to a 2017 bill, which Representative O'Brien referred to, which would have extended the amortization by 10 years. That bill was ultimately voted inexpedient to legislate by the House. Now, this is not to say that NHRS doesn't truly understand and sympathize with the challenges our participating employers are currently facing and any and all efforts they're making to reduce the local tax burden. However, there is very limited discretion in setting employer contribution rates. The state constitution, state law, and as mentioned by another person who spoke this morning, fiduciary duty require the board to use sound actuarial standards in setting employer contribution rates necessary to keep the retirement system on track. Now, among the factors that the board considered in its decision to oppose this bill, which is fairly rare, you tend to hear me say we have no position on anything, but the board does, when it gets to a fiduciary level, occasionally take a position on a bill. Among the concerns were that HB 390 defers a significant portion of the unfunded liability payment into the 2040s, increasing the ultimate cost that employers will pay by approximately $1.4 billion. Another way to look at that is for every dollar that is not paid between next year and 2039, the communities will be paying $2 back between 2040 and 2044. And as again alluded to prior, some issues back in the 90s, and it was actually exactly 30 years ago, back in 1991, when there was going to be a significant percentage increase to the 1992-93 employer contribution rates. The rates were much lower then, but in terms of a percentage increase, that increase was going to be actually higher than the 20% we've seen in 2022. And legislation, this was occurring in a recession. There was a real estate bubble that had burst, and there was a banking crisis in the state, and there were a lot of pressures on local communities in terms of cost. So legislation was introduced that was pitched as a temporary attempt to mitigate the employer contribution increase by changing the actuarial method by which our funding was calculated. That's not what this bill does. It addresses it in a different way. But the temporary solution that was adopted by the legislature back in 1991 remained in the law until 2007. And it contributed significantly to the current unfunded pension liability. Essentially, the folks, the taxpayers, myself included, are paying for decisions made 30 years ago now. And so to repeat, that attempt is going to lead to a similar conversation in this chamber back in 2040 or 2039. Additionally, the board felt that HB 390 would set a dangerous precedent to create a template to refinance pension obligations at the expense of future generations. Back in 2007, the legislature, with input from actuaries, adopted the 30-year amortization plan that commenced in 2010. 30 years was the maximum amount allowed under GASB standards at the time. GASB has gotten out of the standard business on that, but other accounting standards folks refer to a 15 or 20-year amortization as more ideal, but that was what the legislature adopted. This proposal would constitute a deviation from that plan and a step backward in terms of the progress we've made since recognizing the liability. As mentioned in our presentation to the committee earlier this month, we've made positive progress in improving the funded status over the past decade, while many other plans were moving in the opposite direction. And the reason for this is that we have a funding plan and we're sticking to it. So I'd like to defer to George Lagos for some additional comments, after which we'd be glad to answer any questions.
Mr. Lagos, you're recognized.
Okay, I'm on and with you.
Yes.
Thank you. Thank you, Madam Chair. Between our bill brief and Marty's testimony, Marty's covered it quite well. I think he's given you the landscape. And I just want to reiterate a couple things without repeating everything he said. The first is we certainly do appreciate the pressure that's put on local and school budgets, and we understand the concerns that have been expressed. One fundamental thing I just want to say about the public pension plan is that, one of the underlying concepts of how this best works is when the liabilities that are created with somebody's employment for his future pension or his or her future pension are realized, the idea is that they should be paid for as we go along. And that's when the plan works ideally well. In other words, if you do that successfully every year, you never have an unfunded liability, and we'd be paying the normal cost now, and we wouldn't be having 80% of the employer contribution going to the unfunded liability. However, that's the position we're in, as we all know. And that's as a result of not paying the liabilities as they accrued and pushing them out into the future in order to solve an immediate problem. And unfortunately, that's not that far apart from where we are right now today, talking about similar things. And that can be very dangerous because you are pushing the liability out into the future, and it's a precedent you don't want to follow. I think the legislature has done an excellent job since the recognition of these liabilities about 30 years ago, when they created the 30-year amortization schedule and made some other reforms to address these issues. And since that time, the legislature has also been very good about being consistent and diligent and sticking with the plan. And members of the committee, that's really the message I want to reinforce here. I've appeared before the committee on very rare occasions because it's not often that the board takes a position, and Marty typically deals with things day to day. But this situation is one where there is concern of the precedent. That's how we got in the position we're in, and perpetuating that is a very dangerous thing, I think, for not only the current plan, but the plan as it will be 20 or 30 years from now. So what's really what's most important with the pension plan is not so much where you are, because our funded status isn't terrific. It's 61%, but it has increased gradually over the past 10 years, even though we've changed assumptions a couple of times, which increased the liabilities and also have an impact on the funded ratio. But nonetheless, we've made some good progress. So what's more important than where you are is where you're going. And where we're going because of the plan we have is that the original unfunded liability that was amortized for 30 years should in fact be paid off in 2039. That's the way it's structured. Future liabilities or gains that happen between now and 2039 are going to be separately amortized. And I don't want to get down into the weeds on that, but there are two different amortizations going on. So getting back to the point of where you're going is the most important thing. Where we're going is we're improving the funded status, and we have a plan to do that. The last thing I'll say, just because I can't resist, I think I've said it anytime I've testified about the unfunded liability is, the basic notion of when you're digging a hole, you can either keep digging, stop digging, or fill in the hole. And the plan we have here is to fill in the hole. And once we start extending liabilities out into the future, once again, then we are adding to the future burden on the taxpayers. So with that, I'm here on behalf of the Board of Trustees to respectfully request that the committee does not pass this bill and declares it inexpedient to legislate. Thank you very much. I'm happy to take any questions.
Thank you, Mr. Lagos. Representative Elected.
Sure. As I understand it, and correct me if I'm wrong, a significant portion of what the employers are paying is that amortization. And in 2039 or after 2039, that will end or largely end. So what I'm asking is about what portion of what the employers are paying right now is the amortization versus what they should be contributing for pensions for their current employees. And by how much would you expect what the employers have to pay to drop after the 2039 amortization period is over if we do not enact this?
Okay, well, right now, roughly speaking, about 80% of what the employers pay toward contributions for their employees is attributable to the unfunded liability. The vast majority of that is associated with the amortization of the debt out to 2039. There's I don't want to get too technical, but the layered amortization approach just started this last valuation period. So there's 2 years of unfunded liability associated with that. That's going to be amortized out of 20. So the clearest way I can answer your question is the original 30-year amortization schedule calls for the payment of all of that amortization, of all that unfunded liability. So that should reduce that to zero. What is an unknown is what the future gains and losses will be between now and 2039.
Thank you.
Thank you. Other questions?
I guess, so if I'm understanding correctly, 80% of what the employers, cities, towns, the state, counties are paying into the pension fund, 80% is due to that. And is it true then that means that, assuming that that the amount that things are fully funded going forward and there aren't any misestimates and all that, that you'd expect after 2039 that what they'd be paying would that 80% would basically go away.
That is the way the amortization schedule should work with regard to that segment of the liability, yes.
All right, thank you.
You're welcome.
Thank you, Madam Chair. That may have been the answer to my question. My question was going to be, it's 80% right now. Does it decline as we get closer to the end of the amortization?
Yes. Yes, it does. And in fact, it's a 30-year amortization. The first 10 years, the unfunded liability actually increased a little bit because of what's called negative amortization. We've now crossed over. So what we should see, using those, that statement with regard to assumptions, if there were no further liabilities associated or increased, it would continue to decline over that period of time.
Representative Fellows, the repayment is based on a fixed percentage of payroll. And so it isn't exactly the same every year, but it will work. Representative Lekes?
Follow up basically to that. Not sure I understand. So what is it? Why is it that the payment that the municipal employers will have to make towards the amortization, why will it be going down over time? The mortgage, you know, you pay a mortgage, its payments are fixed. It's just how much goes to principal or interest varies. So how does this?
I can take that one, George. This is Marty Carlin. As Representative McGuire mentioned, employer rates are assessed as a percentage of covered payroll, and that's not a mortgage concept. So sometimes when we use the mortgage analogy loosely, it doesn't tie exactly together. Basically, you know, the idea is if all the assumptions were met, you know, every single year going forward through 2039, the percentage of pay on the rate would not change. So if it was, you know, 14% now for members, you know, you're still going to be paying 14% 10 years from now, 15 years from now on a larger payroll base grown through inflation. So in terms of actual dollars year over year, the contributions to the retirement system are going to continue to grow through 2039, when the bulk of that initial unfunded liability as of 6/30 of 17 is paid off. And then the dollar amount would reduce. It'd still be some liability, the billion or so that's been incurred since 2017, mainly due to the assumption changes, and then anything else that were to happen positively or negatively over the next 15 to 20 years. So with this bill, you'd see the dollar amounts being paid continue to rise through 2044, you know, at a higher, you know, the curve would continue to, the wave would just get higher, you know, and the total dollar amounts paid in those last years in the 2040s would be, you know, the highest levels ever. You know, it just goes up.
All right.
Other questions? Thank you, Mr. Carlin and Mr. Lagos. I call Laura Tulesky.
Thank you very much, Madam Chairman. My name is Representative Laura Tulesky, and I represent Nashua's Ward 8, which is Hillsborough 35. I'll be very brief. I know you've had a very long day, but I did want to take the moment to advocate for my city of Nashua, as well as the other towns and municipalities in the state that are finding themselves struggling with this issue. The issue is cities and towns need relief right now. We're experiencing a once in a lifetime pandemic that came out of nowhere. Revenues are up in the air, and a life raft has to be thrown as soon as possible. Passing this bill, or perhaps Representative O'Brien's bill earlier today, is just two possibilities of something that can be done. The reality is our retirees and our future retirees are going to be the ones who are actually hit hardest here. Their property taxes are going to go up, and they're going to need to find ways to make ends meet when they're already struggling. This bill simply provides a little more time to get to that 100% funding. I hope you can support the bill for what it is, which is simply necessary relief for us to get through this challenging moment that our cities and towns did not anticipate. And I thank you very much for your time.
Thank you. Are there any questions? Seeing none. Thank you, Representative Tulesky. I call Arthur Beaudry.
Thank you, Madam Chairman. Can you hear me? You can hear me. Okay.
I can hear you.
Thank you. Madam Chairman, members of the committee, my name is Arthur Beaudry. I represent the New Hampshire State Permanent Firefighters Retirement Association, and I'm here today to speak in opposition of House Bill 390. I would like to give the committee a little background about myself. I am a retired captain from the Manchester Fire Department, and I was a trustee of the New Hampshire Retirement System Board of Trustees from 1988 to 2001. Anyone who was around in the 1990s, as I was, should remember what took place then, and it seems this legislation will bring the retirement system down the same path. In 1990, the legislature decided to change the interest assumption rate from 8% to 9.75% and change the methodology from entry age normal to an open aggregate group method. By making these changes, the state and local communities saved around $72 million. Needless to say, these changes contributed greatly to the system becoming woefully underfunded. And these, again, it's deja vu, because the cities and towns were complaining back then that they didn't want to pay the normal cost. I bring this up because House Bill 390 will bring the New Hampshire retirement system down the same path as in 1990. Currently, the unfunded accrued liability will be paid off in 2039. Enacting this bill will again push the liabilities down the road another 5 years at an additional cost to the employers of $1.4 billion. Yes, I said billion with a B. For every dollar the employer saves today, it will cost them $2 in the future. Penny wise, dollar foolish. The New Hampshire retirement system contributions should be based on sound actuarial procedures and not based on what the economy is at this particular time. Hopefully, we have learned from our mistakes in the past, and please do not allow history to repeat itself. If you look, I have some old data. I don't know what the retirement system has given you today, but if you look at once the unfunded accrued liability is paid off, the employer normal cost is going to go down astronomically. I mean, the numbers I have, the employees would be at 1.292%. Teachers will go down to 1.86%. Police will be at 5.04%, and fire will be at 6.35%. That is much less than what the employee will be paying. And even back in the 1990s, when they chose to change the methodology and change the interest assumption rate to save the cities and towns money, the employees at the time, I believe, except maybe fire were not, but the employees on teachers, state employees, and I believe police were paying, the employee was paying more into the retirement system than the employee. So, you know, the unfunded accrued liability has to be paid off. And the longer we keep pushing this off, you're looking at billions of dollars that the taxpayers are going to have to come up with in the future. So with that said, I would please appreciate that the committee vote the ITL House Bill 390. And I thank you for your time, and I'll answer any questions.
Thank you, Mr. Beaudry. Other questions?
Thank you very much.
Representative Pearson?
I got a question for Mr. Beaudry if he's still on.
I am still here, if you can hear me.
I can. It's my understanding, and I may be confusing the group, so this is my question. It's my understanding that the organization to which you are president of sounded a very loud alarm in the 90s, warning communities that the actions that were being taken and the funding method that was being used was inadequate, incorrect, and woefully negligent. Was that your organization that sounded that alarm in the early 90s, or was it somebody else?
No, it was the Permanent Firefighters Association that did that. And that was when I was seated as a trustee. We warned them back then. We even testified before the legislature that it was inappropriate for them to take the authority away from the Board of Trustees at the time to set the interest assumption rates and change the methodology. It went on deaf ears. And it was all because the cities and towns and the state wanted to save money at the time. And this is what happens when you try to save money. It ends up costing you more in the long run. But yes, it was the New Hampshire State Permanent Firefighters Retirement Association that was on record then and continue to be on record for many years after that that was not the way to go.
Thank you. Are there any other questions from the committee? Seeing none, thank you, Mr. Beaudry.
Thank you, Madam Chairman.
Mayor Donches?
Yes, Madam Chair. Can you hear me?
Yes.
All right. Well, I won't repeat some of the testimony that I gave you regarding House Bill 274 concerning the hardship this is going to cause or is causing on taxpayers across the state. And Representative Tulerski touched on that as well. So I will not repeat that, but instead talk about some of the aspects of this particular bill. Now, the reason we're here is that the state retirement system reduced the assumed rate of return over the next decades by 0.5%. I believe Mr. Lagos can correct me if I'm wrong, but I think from 675 to 625, or from 725 to 675, but reduced it by 0.5%. Now, before that decision was made, the system was 65 or 66% funded. The reduction in the assumed rate of return is causing this increase over and above what would normally be caused by the increase in, natural increase in wages. Now, again, I give you Nashua's numbers, not because we're different or more important, but just because I can give you those numbers and it gives you a perspective. We're going to be going up from about 25 million to nearly $30 million this year paid into the state pension system. 80% of which, you've heard that, 4/5, 80% of which it has nothing to do with current employees. All has to do with the recapitalization or the building up of the reserves in the pension system. 4/5 of the money we're paying in is for this unfunded liability, or on $30 million, that's about $24 million we're paying on an annual basis under unless you help us with this bill, $24 million into the unfunded liability. This is nowhere near 1991. This is a totally different situation. In 1991, decisions were made when the fund was 100%, which were not sound. Yes, I mean, everybody agrees on that, which resulted in part in the underfunding that we have faced, in the last 10 or 15 years. But right now, again, we are paying 5 times under the, without some relief, 5 times what it takes to support current employees with this increase. In other words, 80% of what we're paying is for the unfunded liability. So we're paying 5 times what it takes to meet the obligations that will be created for current employees. Back in 1991, they made a decision which caused the contributions coming in to be less than were necessary even to pay for the current retirees. That is not what we're advocating at all. We're currently paying 5 times what it takes or we would be paying 5 times what it takes to support current retirees. Now, if you give us this 5-year relief, it will ballpark, I mean, you could get these specific numbers, but ballpark, it would about offset in our case, again, just using our numbers, the $4 million increase that was caused by the reduction in the assumed rate of return. So think about that. All right, so then we're paying in 26 million instead of 29 or 30. Still, it's only going to take, 20% of the 30 million. It's only going to take about $6 million to fund any obligations that would be incurred as a result of current employees. So if you give us this relief and our contribution is 25 instead of 30 or whatever, we will still be paying 18, 19, 20 million towards the unfunded liability. So the idea that we would be digging a hole, no, we would still be paying millions and millions and millions of dollars every year to help fill this, help build up the reserves. So the idea that we would be digging a hole or this is like 1991, there's no comparison, no similarity at all. Now, I wanted to address the issue of, this will cost more money in the future. And the home mortgage is, an approximate analogy. The cheapest way to buy a house is, in terms of total dollars out, is simply to pay cash. Just go across the street, put down $300,000 and you got the house. You don't have to pay any interest, no future costs, no problem. People can't afford to do that. The next cheapest way is like a 5 or a 10-year mortgage. Less interest than a 30, a lot less, you pay less over time. but people can't afford that. They don't have enough money in the present. You can, 15-year mortgages are available. Most people don't do that because they don't have the money. So the standard is a 30-year mortgage. So the idea that, it is somehow illegitimate to say, look, we instead of paying this back over 23 years, we need a little bit extra time. Or excuse me, instead of paying it over 18 years, we need a little extra time. That's not so unusual. We're still paying it off. We're still making principal payments every month, just not quite as much. And the reason we're asking is we can't afford this right now. COVID and everything else. This is, about 15% of the taxes that a taxpayer pays in are for this one line item. That's for an average homeowner. It's almost $1,000 they're paying in just on this one thing. So it's not so unusual for us to ask for a little time. And just to get into a little more deep in the weeds, Madam Chair, yes, in 2043, $1, there would be extra interest paid. But if you use sort of financial methodology, money paid out in the future does not have, has a dollar paid in 19 years does not have a present value of $1. It has the present value of, you can figure it out depending on the assumed rate of interest, but it might be 50 cents. So, in present day dollars, you're really not paying out more money. Yes, you're paying dollars that are worth less than $1 today, way in the future, but that's pretty technical and in the weeds. So I just go back to the point is we need relief. We would still be paying tens of millions of dollars to settle the unfunded liability, and giving us a little relief, a little extra time is not going to be the end of the world. Finally, Madam Chair, I apologize, but I wanted to make this point. And I'll try to make it briefly. The idea that the pension systems have to be at 100% make more sense in the private sector. If GM goes bankrupt, and if their pension system is not 100% funded, the pensioners don't get paid because they get partially paid, but mostly not. But that is if GM ends and goes bankrupt. Now, we are a state, part of the United States. The only way that this pension system and the state of New Hampshire will stop, and there would be a necessity to just have in the bank enough to pay out everything without any more contributions, would be if the state ceased to exist as an entity. Because otherwise, there's $10 billion in the bank. You're getting contributions every year, which greatly exceed the need for current retirees. So unless the state ceases as an entity, whether you're at 60 or 80 or 85, or whether it's at 2044 or 2039, it doesn't really matter because everyone is always going to be paid. The only way the state of New Hampshire will end is if the United States as a country collapses. And if that happens, pension assets will not be stock markets, pensions, there won't be anything there. So it won't make any difference at all. So this sort of hardline theoretical concept that we have to go to 100% doesn't apply that well when you're talking about a government entity or a state such as New Hampshire. So I apologize I went on so long, Madam Chair, but I'm still available for any questions that anybody might have.
Thank you, Mayor Donches. Are there any questions? I don't see any hands, so thank you. I call Dennis Corrigan. Mr. Corrigan?
Madam Chair, were you calling Mr. Corrigan to testify?
He has permission to speak. He needs to unmute.
I apologize. I was hoping you could hear me.
What's that, huh?
Can you hear me now?
Yes, thank you.
Thank you. Sorry.
No, he didn't.
Let me start over. I'm testifying on behalf of the Granite State taxpayers, and we want to strongly associate ourselves with the remarks of Marty and George and Mr. Beaudry. I was very heartened to hear that the New Hampshire Retirement System Board voted unanimously to recommend ITL on this bill. That's our recommendation as well. The my professional opinion as a pension actuary is that there are important reasons that pension plans should be fully funded at all times to provide security to pension plan beneficiaries. And while New Hampshire's system isn't the worst funded state plan in the nation, its funded ratio of 61% is very poorly funded compared with private sector plans. No private pension plan would be permitted to operate indefinitely with a 60% funded ratio. The Pension Protection Act of 2006 provides that large private sector pension plans are considered at risk of defaulting on their liabilities if they have less than 80% funded ratios using standard actuarial assumptions. And the New Hampshire retirement system assumptions are much weaker than standard actuarial assumptions. Now, the New Hampshire system looks bad compared with other state plans as well. The Tax Foundation says that in 2019, only 20 states have pension plans that are less than 2/3 funded. So basically all private sector defined benefit plans pursue 100% funding by amortizing any shortfalls over 7 years and increasing plan contributions accordingly. We've heard that this is presenting a hardship to fund the unfunded liability now and over the future 30 years. But really the hardship is caused by the benefits that have been promised. And no one is suggesting that those benefits be pared back. And if that doesn't happen, they simply have to be paid for. They have to be funded. We've heard also that this is a little relief, but $1.5 billion of extra spending by the state of New Hampshire, even if those are future dollars, is a staggering amount of money for the state to contemplate. So I would really urge that an ITL evaluation recommendation on this. Basically, if this bill passes, the unfunded liability will be, instead of 0 at 2039, it'll be $2.3 billion. And where's that $2.3 billion going to come from? Glad to take any questions.
Thank you. Are there any questions on the committee? I don't see any, so thank you very much.
Thank you.
Anyone else who wishes to testify on House Bill 390?
Madam Chair, John Griffin.
Yes, Mr. Griffin, please speak.
Thank you, Madam Chair and members of the committee. For the record, my name is John L. Griffin. I'm the CFO for the city of Nashua, which is a position I've held for the last 10 years. So I've actually become very familiar with this topic. Not to say what everybody else said, I'll get into the specifics of Nashua and the kind of the competing balances that we're trying to weigh. But applying the increased employer rates that have been certified by the NHRS for pensionable payroll wages, we're going to see an increase, as Mayor Dodge just indicated, of approximately $4 million. Every $2 million for the city of Nashua in increased spending or reductions in revenue is 1% on the tax rate. Therefore, this particular increase is 2% for this one item. We've been fortunate in the city of Nashua to keep our spending and our tax increases under the 3% mark for probably 9 out of the last 10 years. So this will put a significant burden on the city. And as was said previously, services have to be reduced, or tax burden on our taxpayers would have to increase. The impact of adopting HB 390 will have the effect of reducing the current NHRS employer rates that have been talked about. And this, at this time, given the pandemic and the other pressures on city government, is much needed to balance the competing needs that are facing the municipalities. I do intend to provide written testimony encapsulating this information, and I am supporting, hope you would support HB 390 and be available for any questions you may have. Thank you.
Thank you, Mr. Griffin. Are there any questions from the committee? Seeing none, thank you for the testimony. Does anyone else wish to speak on House Bill 390? In that case, I will close the public hearing. Let me poll the members. How many people are interested in continuing the exec on House Bill 91? 1, 2, not really. All right, there are 6 hands raised, and I see that 6 people have raised their hands. I presume it's committee members.
I'm trying to raise my hand as well.
All right, that makes 7.
Just about to vote. If we're ready to vote, let's do it.
It sounds like there's enough. So resuming the session on House Bill 91. When we left off, Representative Hewitt was online to speak.
Thank you, Madam Chair. Yes, I was just going to state basically the same thing that Representative O'Brien was saying about comment about your work affecting your marriage quite often. Having been married to a law enforcement officer, I know this to be true. In addition to firefighters, police officers see some pretty nasty things from time to time, and it can't help but affect your mental well-being. And so I think that, and I will say, I know I've heard previously that divorce rates amongst first responders are usually higher than the average population. And I think it's because of a lot of the job stresses that it's difficult. You can't even talk about some of these things when you get home. So it's difficult for a spouse to understand those kinds of pressures. So I think that a suicide, while it may not seem to be job related, quite often it's really a result of the stress on the job. Thank you.
Does someone else wish to speak? All right, there's no hands raised and no one speaking. So the motion is ought to pass by Representative Roy, and the clerk will call the roll.
Representative Roy.
Yes.
The clerk votes yes. Representative Pearson.
Absolutely.
Representative Yakubovich.
Yes.
Representative Fleckus.
Yes.
Representative Allegro.
No.
Representative Bailey.
No.
Representative Lanzaro,
Yes.
Representative Santo Nastaso,
No.
Representative Goley,
Yes.
Representative Schuett,
Yes.
Representative Judy is not on video. Representative Schmidt,
Yes.
Representative Schultz,
Yes.
Representative Fellows,
Yes.
Representative Funkno,
Yes.
Representative Groden,
Yes.
Representative O'Brien,
Yes.
and the chair.
I'll have to vote no. I get 15-3 when asked.
14-4.
Who's the fourth no vote? I have
Clerk
11.
is muted.
Santo Nastaso and McGuire.
Okay, Representative Stasso, did you vote yes or no?
I voted no.
14-4.
Thank you. Right,
I have 4 no's. What's the yeses?
no, this will not be on consent. I will not write a minority report. If any of what the other no votes wish to, I need it as soon as possible.
Excuse me, Madam Chair, would you please give us the final vote on that?
14-4 was my mistake.
Thank you.
You will make the motion, you will write the report. All right, thank you all for surviving a delightful day. We will get through our technical difficulties. On Monday, we will be getting through the last of our early bills and a bunch of other fun stuff. And hope and I will see you then.
Madam Chair,
Very much.
Madam Chair,
Yes,
quick question. I just want to be sure that if members do come in to attend these hearings, that the House rule will be adhered to, that if members are in the room, they can not have a mask on if they are seated, but if they are moving around, they must put a mask on. I noticed a few times today, people were walking around with no masks on, and I want to make sure that's going to be adhered to.
I believe that has been the practice, but except for the distressing incident of the chair falling over, but yes.
Thank you.
Can you please repeat that? It's coming kind of garbled.
Representative Goley wants to make sure that we adhere to the best technique, which is we can remove a mask when we're sitting in our seat, but when we're moving around, we should wear one.
Thank you very much for that clarification, Madam Chair, and that position as well. I take we have nothing for tomorrow.
No, we are through with today's business.
Thank you for today. I have another meeting. I'll be leaving.
Madam Chair, you mentioned Monday. Are you referring to February 1st?
Monday, February 1st. It's already in the calendar. It has been posted. I believe we're going to be on Thursday next week, but the days are being allotted rather oddly, so I can't tell you exactly. Monday's in the calendar.
I can confirm, Madam Chairman, that you have scheduled for a full day for Thursday, February 4th.
Monday and Thursday.
Yes.
All full days, so we'll have fun. I don't know what room we'll be in. I believe on Monday we're back up on the 3rd floor, but
It does, when you check in, they tell us.
Yeah.
they will tell us. It's in the elevator.
Dan, if you're here, I'm going to run some papers up to the 4th floor for Miriam when I get processed this stuff, okay?
Actually, if you just leave it right there on the table, we'll pick it up. That's the best way.
Okay.
we'll come down and, straighten up the room and get it organized for the next committee. So just leave your clerk's notes right there and we'll scan them off to Miriam.
Representative Foley. Representative Foley,
Yes, Representative Saitek.
I want you to take note that I did not screw up calling the roll at all this time.
Duly noted.
All right, thank you all. Have a good weekend. Read up on Monday's bills and I'll see you then.